Viva islasen para Gitodui tempui pas para ita dan gini langit na bendisyon Kontray peligro na fansafuham Deus protege Island Guam Kontray peligro na fansafuham Deus protege Island Guam There's a little island across the sea. Come on, my friend, take a trip with me to an island that I call home, where you can roll your windows down and feel the breeze. Stick your foot out, 5 piggies. Oh, I wouldn't change it for the world. 'Cause I love Guam, I love you. I've got love for all my loon.
Oi, good morning.
I love girls.
Good morning, Guam.
Off a day, everybody.
It's containing COVID. What
Tuesday,
day?
right?
It's Tuesday,
Tuesday?
yes.
All of us strong.
We've got Joser over here and
Yep.
Jason. Say hi, guys.
Yeah, we are ready to go. It's 6/13, Tuesday, the 7th day of April. Honestly, I was keeping a running track of how many days we've been in quarantine and mandatory social isolation orders. I'm going to have to get back to you on that because the days are just blending into one another, and a lot of people wake up, they don't know what it's Tuesday, okay?
Tuesday.
April 7th, Holy Tuesday during Holy Week, and we're going to get Father Paul Goffigan, the People's Priest, up here on the show in a little bit. But of course, as we always do on Containing COVID, I want to wish you guys watching on our Facebook live stream a very, very good morning to you. And our listeners on I-94 FM, again, the number 637-0094. But let's start things off here on Containing COVID with a first look at our news with Sabrina Salas-Matanani. Good morning, Bree.
Half a day and good morning, everyone. According to the latest Joint Information Center release at 7:45 p.m., Public Health tested 13 individuals for COVID-19 on Monday. 1 tested positive through Public Health and 12 tested negative. Public Health's overall count also includes an additional 2 cases of COVID-19 that have been clinically diagnosed. While these cases have tested negative, they have imaging findings consistent with COVID-19, displaying typical symptoms, have epidemiological links to previously confirmed cases, and are being treated as COVID-19 cases. The overall count also includes 9 positive cases that were tested by the Naval Health Research Center in San Diego. To date, a total of 111 cases tested positive and 2 were clinically diagnosed, with 25 recoveries and 4 deaths. So that brings the total of confirmed cases of COVID-19 on Guam to 113. The community, in the meantime, is asked to cooperate with public health callers who are performing contact tracing. Public health officials will contact individuals who have tested positive for COVID-19 or those who were reported as close contacts. These phone calls will be from a local landline or mobile phone number. Contact tracing calls are not a scam. Public health never asks for social security numbers, credit card, or banking information during these calls. As for news out of the CNMI, the governor's COVID-19 task force and Commonwealth Healthcare Corporation would like to inform the public that during this week, 118 individuals are completing their 14-day quarantine. These individuals are commended for their commitment to this directive and for their spirit in protecting the health of our community. These 118 individuals were placed under quarantine in a designated quarantine facility pursuant to Governor Ralph Torres' second amended executive order, requiring that all individuals entering the CNMI be quarantined at a designated site for 14 days. Upon completion of the respective quarantine period, each individual will be issued a certificate from the CHCC indicating that they successfully completed quarantine. This certificate doesn't mean that the individual is not at risk for contracting COVID-19. They are still advised to follow precautionary measures as they re-enter the community, such as staying home. The governor's COVID-19 task force and CHCC remind the public and those who are leaving quarantine that the best way to protect yourself and others from COVID-19 and other illnesses is to stay at home to stop the spread. In national news, the doctors leading the nation's coronavirus response are warning this could be the worst week yet. More than 337,000 cases of coronavirus have been reported in the United States, and more than 9,600 people have died. Inside a Brooklyn hospital, 80% of the patients are being treated for COVID-19, some requiring intubation the second they arrive. Louisiana is expected to open a 1,000-bed makeshift hospital inside the New Orleans Convention Center, a day after the state experienced its largest single-day uptick in deaths. In Texas, officials there are now stopping people coming in from Louisiana, asking for documentation on where they're going, and if they're staying, they must self-quarantine for 14 days. A New York City councilman says one of their contingency plans is temporary burials in New York City's parks if the number of deaths goes beyond what the medical examiner's office can handle. Meanwhile, President Trump says he thinks doctors should use the drug hydrochloroquine to treat patients who have tested positive, but the doctors leading the coronavirus task force are advising people to slow down. A new report from the Department of Health and Human Services Inspector General says hospitals across the country face dire shortages of the medical equipment needed to combat the pandemic. The report says it's not just masks and ventilators that are in short supply, it's also thermometers, disinfectants, cleaning supplies, and toilet paper. The president says the government is sending gloves, gowns, and masks to hospitals, but the report says many of the supplies were already delivered were out of date or defective. A spokesperson for the Department of Health and Human Services says the agency is working day and night to support local communities and take actions to help our healthcare system respond quickly and effectively. In national news, Task and Force is reporting that Acting Navy Secretary Thomas Modly made an unhinged speech to the crew members of the USS Theodore Roosevelt in which he lashed out at former Captain Brett Crozier and told sailors to stop complaining and do their jobs. Modly fired Crozier on April 2nd, 2 days after the San Francisco Chronicle published a leaked copy of a memo written by Crozier in which he warned his superiors that sailors aboard the aircraft carrier would die of the novel coronavirus unless about 90% of the crew were moved into additional quarantine. Crozier has since tested positive for COVID. Speaking to the crew of the Theodore Roosevelt over the weekend, Modly said, quote, "If he didn't think, in my opinion, that this information wasn't going to get out in the public in this day and information age that we live in, then he was either A, too naive or too stupid to be a commanding officer of a ship like this. The alternative is that he did this on purpose, and that's a serious violation of the UCMJ, which you are all familiar with." Modly also chastised the Theodore Roosevelt's crew for cheering Crozier when he left the ship, claiming the former commanding officer's memo caused concern among residents of Guam, where the ship is currently docked.
Okay, and I'm going to play this clip here, from Acting Secretary Modly, and we're jumping in to his address. We understand he gave it over the ship's intercom system, and right now he's talking about the letter that Captain Crozier had sent out.
And that email went out to a broad audience of people. I know that I mentioned that it was over 20. We believe it was forwarded to even far more than that. And immediately it was picked up by the San Francisco Chronicle, which published sensitive information about the material condition of a naval warship. If he didn't think, it was my opinion, that if he didn't think that information was going to get out into the public in this information age that we live in, then he was A, too naive or too stupid to be the commanding officer of a ship like this. The alternate is that he did it on purpose. And that's a serious violation of the Uniform Code of Military Justice, which you are all familiar with. That message and all the contents in that message was perfectly fine for him to send to people in his chain of command in a confidential way so they could get acting on it. He, in fact, could have given it directly to me through my chief of staff or to me as I asked him to do when I first reached out to him on this ship, when we first found out that there were COVID cases here. It was a betrayal of trust with me, with his chain of command, with you, with the 800 to 1,000 people who are your shipmates on shore right now, busting their asses every day to do what they need to do, to convert what they do in a normal day, to get you guys off of here, get you safe, get you healthy, get you clean, and get you back on this ship where you're supposed to be. It was betrayal. And I can tell you one other thing. Because he did that, he put it in the public forum, and it's now become a big controversy in Washington, D.C. and across the country about a martyr CO who wasn't getting the help he needed and therefore had to go through the chain of command, a chain of command which includes the media. And I'm going to tell you something, all of you. There is never a situation where you should consider the media a part of your chain of command. You can jump the chain of command if you want and take the consequences. You can disobey the chain of command and take the consequences. But there is no situation where you go to the media, because the media has an agenda. And the agenda that they have depends on which side of the political aisle they sit. And I'm sorry that's the way the country is now, but it's the truth. And so they use it to divide us. They use it to embarrass the Navy. They use it to embarrass you. While you're out here dealing with something that this country hasn't had to deal with in over 100 years. And the world hasn't ever dealt with anything like this on this scale. The American people believe in you. They think of all the people in the world that can keep the shit together in something like this, it's the United States Navy and our sailors. And they're stressed. They may be stressed. They may be tired. They may be scared. But they're keeping it together. And they're taking care of each other. And they're taking care of their people on the shore who are busting their ass to get them off this ship. They're not taking shots at them. They're asking, how can we help them? What can we do? How can I help the E3 that works for me? I'm an E4. I'm concerned. What do I do to help the E2s and E3s that are on this ship? That's your duty. Not to complain. Everyone's scared about this thing. But I tell you something, if this ship was in combat and there were hypersonic missiles coming at it, you'd be pretty scared too. But you do your jobs. And that's what I expect you to do, and that's what I expect every officer on this ship to do, is to do your jobs. One of the things about his email that bothered me the most was saying that we're not at war. Well, we're not technically at war, but let me tell you something. The only reason we're dealing with this right now is because a big authoritarian regime called China was not forthcoming about what was happening with this virus. And they put the world at risk to protect themselves and to protect their reputations. We don't do that in the Navy. We're transparent with each other in the proper channels and with each other. And that's what we're supposed to do, and that's what you're expected to do. I got your list of questions. I'm very, very thankful to have gotten them. I know they're all sincere. I don't think there's any agenda in any of those, but there's a lot of them. And I'm going to answer every single one of them, but I've got to do it respectfully, and I've got to take some time so you understand all the nuances of the questions that you're asking, and there's a lot of them here. So rather than answer them all today, I'm going to take them back with me to Washington, and I'm going to answer them. And let me say one other thing. Everything I'm telling you guys right now, I will never, ever, ever throw you guys under the bus in Washington or anywhere else, in the media, anywhere else. And I expect you never to do that to your shipmates either. The ones on the shore right now, who told me that when Captain Crozier's email made it to the San Francisco Chronicle, after working 15-hour days, they were demoralized because they knew what they had been doing for you guys since the 25th of March to get you guys what you need. And the other thing you need to understand is we're in Guam. It's a U.S. territory, but they have their own government, and they have their own health care problems, and they're scared too, just like every other part of the world. And the governor of Guam has stuck her neck out big time with her own population to say that she is willing to open up hotel rooms all over this country, or this state, this territory, so that sailors from the USS Teddy Roosevelt can go and be safe, because she believes that you all are her brothers and sisters. Her brothers and sisters who are protecting this place for her citizens. And so she's willing to put all that at risk to take care of you guys. And she told me today, when Captain Crozier's letter came out in the public, she had to then deal with all her constituents who were saying, holy crap, what's happening? We're going to have 5,000 people with COVID in our city without proper health care and everything else. So think about that. When you cheer the man off the ship who exposed you to that. I understand you love the guy. It's good that you love him, but you're not required to love him. So I want to share something with you that I read at the Naval Academy graduation in 2018. I said it to the graduating class, but I'm going to expand it a little bit. I said, as officers and sailors in the United States military, you are given tremendous responsibility to respect and protect those who are placed under your command. The American people entrust you with their sons and daughters, and they place their security and the security of our nation in your hands. Do not expect to be loved by everyone for this, even though it may happen. As Secretary Mattis, my former boss, was fond of saying to us, who were so honored to work with him in the Pentagon, he said, your job is to protect the nation. So I'm going to give you a little bit of advice to make this important and often difficult job far easier on yourselves. My best advice to you is don't ever worry about being loved for what you do. Rather, love the country that you're asked to defend. Love the Constitution you pledged your lives to protect. And most importantly, love the people you are ordered to lead. Make sure they eat before you do. Care about their families as much as your own. Be vested in their success more than your own accomplishments. Nurture their careers more than you pursue your own advancement. And value their lives to the point that you will always consider their safety in every single decision you make. It's only through this level of servant leadership that you will maximize and empower those you lead to meet the demands that will face us in this century. And those demands are getting more complicated every day as we're all learning.
There you go. That's Acting Secretary of the Navy, Thomas Modly. If you were just joining us, you didn't know what you were hearing. That was a recording one of the sailors on the Theodore Roosevelt made of Modly, who apparently was on Guam, and apparently...
Wait, I'm not sure if he was on Guam.
Are you sure?
I'm not sure.
I thought he said he met with
It
the
doesn't
governor.
matter because
Yeah.
that audio
Yeah.
was whoa.
Yeah, it was a lot. Wow.
He did mention the governor of Guam. He said, if you didn't hear that part, he said, the other thing you need to understand is we're in Guam. It's a U.S. territory, but they have their own government and they have their own healthcare problems, and they're scared too, just like every other part of the world. And the governor of Guam has stuck her neck out big time with their own population to say that she's willing to open up hotel rooms all over this country or this state, this territory, he didn't know, so that sailors from the USS Theodore Roosevelt can go and be safe, because she believes that you all are her brothers and sisters who are protecting this place for her citizens. So she's willing to put all that at risk to take care of you guys. And she told me today, when Captain Crozier's letter came out to the public, she then had to deal with all her constituents who are saying, holy crap, what's happening? We're going to have 5,000 people with COVID in our city without proper health care and everything else, end quote. So think about that when you cheer the man off the ship who exposed you to that. I understand you love this guy. It's good that you love him, but you're not required to love him.
Yeah, that was pretty, I would say maybe the wrong approach. You know, it is the military.
Yeah.
So that was pretty interesting. I think Jason popped that in the comments. If you guys want to give that a listen, I know we have there's quite a few family members of local sailors on the Theodore Roosevelt who might get a kick out of that maybe, or just want to listen to it to figure out what the leadership. We talk about leadership, but that's the top. That's as high as you can get
of the Navy. And that's
Right.
like the whole thing is probably I think about 17 to 18 minutes long.
Right.
So it's definitely something, if you have the time, check
Yeah.
it out. And you should, because you should be at home. You should listen to
You
it.
should have all day to check this out. And just a heads up, there's a couple of the curse words. There's a saying, mouth like a sailor.
Definitely.
So that's at 637-0094. It's containing COVID. We're going to take a break. We'll do some news, and we're coming back. We've got a lot of people calling in this morning. 9 o'clock, if you are a small business owner, you know anybody who's small business, we're getting Ken Lujan from the Small Business Administration
Yes.
on the call. And then we're also going to talk to Phil Flores of the Guam Banking Association about the Paycheck Protection Program. So 9 o'clock, maybe you want to put your little business hat on and listen up for that.
Your little business hat.
Yeah, your business mask, okay?
Okay.
Hey, and mask up. And remember, the press conference yesterday, I wanted to ask the governor, hey, I know you don't have the authority and we're waiting for the senators to jump through all the hoops and all that, but what would your message be to the people of Guam who have the power to lock themselves down? And that's basically what she said. She said, hey, I'm pleading with you guys.
Mm-hmm.
Do your part.
That was your second question, though.
Yeah, so... I mean, it is what it is.
You got shut down.
I did get shut down, but, I'm going to come back again today if you guys will let me. So I'd asked the governor yesterday, hey, have you heard from Speaker Tina about emergency session? And she was like, no, I haven't.
No. Next question.
I mean, I just thought it was an
I
emergency.
thought you were going to get another question in there after.
Yeah, I know.
but
I
it
thought
is what it
I'm
is.
just saying that, no, that's it. I mean, come on.
Well, you
It's an
shouldn't have
emergency.
asked a yes or no question.
Okay, you're right. I'm getting schooled over here by one of the most experienced reporters. Okay, no more yes or no questions. I got it. Hey, let's do news at 6:33. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Howdy, Marianas. This is Tomas Maglonia on the island of Saipan, reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
We've heard the latest information. I mean, just yesterday we learned there were 17 more cases. We've seen the projections from our medical team that really again a lot of that sobering data that we all have to take seriously.
Guam Department of Education Superintendent John Fernandez said following Governor Lulian Guerrero's executive order to further extend the lockdown until May 5th, he made the call to end classes, cancel fourth quarter sports, and close down schools for the rest of the 2019-2020 school year.
We discussed this amongst my leadership team, and I mentioned to some of our board members, there doesn't seem to be any possibility or any scenario where bringing 30,000 students and 4,000 employees back in contact with each other at our school sites on a day-to-day basis. There's just no scenario where that makes sense.
Fernandez sent a letter to the Guam Education Board members this morning informing them on his decision and asking for their support on the matter by suspending certain board policies. The policy is up for discussion at the special board meeting scheduled for Wednesday, April 8th at 3 p.m. Include grading, promotion, and the service learning requirement for high school graduating seniors.
The third quarter grades seem to be where everybody seemed to reach a consensus on. These are grades that the students did earn through their work and effort, and carrying them over to the fourth quarter, even though we know that some students may have wanted to do better and work harder, or some might have not done as well. We're just going to have to call it even.
Fernandez adds it's highly unlikely there will be a physical graduation ceremony. And due to the unique circumstance, GDOE plans to launch a senior resource page on their website to announce further updates on graduation and credits. Fernandez says it was with great disappointment to make the call to end the school year, but he shares this message to all 30,000 GDOE students.
I want all of our kids out there to know that as we discuss the situation with management, with their teachers and administrators, all of us, were unable to say goodbye to our students this year, and especially to our graduating seniors who, again, we talk about this year's crop being born around 9/11 and now graduating during this COVID-19 pandemic. What an amazing class of 2020, the experiences that they've gone through.
Reporting for Guam's News Network, I'm Adriana Cotero.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
They're a collective of undergraduate students from the University of Guam and Penn Foster College, aimed at helping the community during difficult times. Alana Fergerger, who handles social media engagement, explains the meaning behind the name Wonder Kid Project.
The Wonder Kid name itself is meant to represent hope and admiration. Going with the superhero-esque name, everyone who takes part in our mission, we hope, finds the superhero within them to give opportunity for the community to admire.
According to Point of Contact for Family Assistance, Maria Minas, with the COVID-19 pandemic taking a large toll on the island's healthcare system and affecting the lives of many, the team had a fundraising idea for a startup project to kickstart their mission.
This is a crowdfunding project for our local community on Guam who are heavily affected by the COVID-19 pandemic, such as our frontliners and families facing extreme poverty. Specifically, our main beneficiaries include the Guam Memorial Hospital Volunteers Association, Guam Harvest House, and St. Dominic's. And through your generosity, your donations can help purchase supplies such as masks, disinfectants, and food.
To date, the group has raised a little over $1,200. Project coordinator Aries J. Moreno.
I understand that it's a very difficult time for everyone, so if you would like to donate, you can go ahead and visit our GoFundMe page through our social media platforms, or you can actually go straight to GoFundMe and find the Wonder Kid Project Guam COVID-19 Relief and donate through there. And if you don't have the means to donate, that's okay. You can go ahead and just share our information through your friends and families.
If you would like to know more, you can follow them on Instagram at The Wonder Kid Project or email them at info.thewonderkidproject@gmail.com. Reporting for Guam's News Network, I'm Jonah Goncharfris.
Buenas and half a day. Mabuhay. What's up, Guam? I'm Norm. If you're watching this from home, then great. But if you're somewhere you don't have to absolutely be, please go home and stay there. I know it's difficult for us to change our routines and habits, and personally, I'd rather be with my family and friends dining in a restaurant or going to the movies. But the timing, it's just not right. We're asked to make a little sacrifice now, but in the long run, it'll help to ensure that you and your loved ones remain safe. We're dealing with an unprecedented health crisis, and we need everyone's cooperation. Let's fight the spread of the coronavirus by doing our part to stay home so that Guam can stay safe.
.640. Guam's favorite. Yeah, you know, one of the big pieces of information that they revealed, of course, we reported on this, was that we now have some COVID-19 cases with children.
Yeah, that was at a total of 6 children among the infected. Nestor LaConta did the story for us on primetime last night. Public Health Linda DeNorsi saying that a 1-year-old individual baby, and it was due to household contact. In regards to 10 to 19-year-old age range, there were 5, and of the 5, 3 were household contacts. 1 was travel related from Honolulu, and the other was a social event where they caught the infection. So a total of 6 children now among those who've tested positive for COVID-19.
That's right, and that's why it's so important to obey the governor's social distancing and, mandatory social isolation measures and the non-essential business closures. Because when you get into close contact with people, the opportunity for COVID-19 to spread, whether it be through, aerosol droplets that you sneeze or you're sick or whatever, or you touching your face, touching everything. And that's the whole point of us staying home. So
right. And as we reported yesterday, the governor extended her declaration of a public health emergency until May 5th. All public schools have been canceled. All fourth quarter sports. They still have their grab and go program underway, except for this Friday. They're taking that day off for Good Friday, but it'll return on Monday. They still have distance learning. DOE is still going to be offering that until the end of the school year. But again, like Chris said, 6 children among those infected.
And sorry, I'm just we're both parents. There's so many parents out there. I mean, as if you weren't going through enough, there's just that added layer now. And I think a lot of parents kind of just were going on the assumption that kids, I'm not saying can't get it, but I mean, we haven't seen a lot of stories nationally and internationally about kids getting COVID-19. And so now this is something that parents got to worry about, especially with kids like what my kid's been doing. Not playing with other kids, but they're wrestling around. I mean, kids are having fun. So, I mean, it's important to extend that 6 feet apart thing to, I guess, everyone in the family. And I'm working on getting a pediatrician on the line because, of course, I know as parents, we're all wondering what happens when kids get COVID.
Yeah, and yesterday was a really hard day. After hearing about the 4th death over the weekend and then the spike in the number of cases.
Right.
And then when the governor opened it up and she announced that there were 6 kids that were affected, I mean, that really hurt. And it was so deep. And I immediately following that press conference, I FaceTimed my son and had to remind him again. And I know he's tired of me saying it, but I can't say it enough. Did you wash your hands? Where's your mask? You need to put on your mask. And he's like, Mom, and I'm like, no, this is serious, son. Don't think that you're not going to get sick because you can get sick.
I think that's one of the takeaways from our conversation with Dr. Akimoto yesterday was that, young people are affected by this.
Well, in the CNMI, it was a 14-year-old girl.
Right.
That was last week. And so to hear that this week, 1-year-old, right? That was 1-year-old.
Yeah.
And 10 to 19.
We're also trying to get Linda from Public Health. I think that, we need to ask more than 2 questions.
Yeah.
So hopefully we'll be able to get a hold of her.
In particular because of the 13. They only ran 13 tests yesterday.
Right, yeah. And so we're trying to figure that out. What I don't appreciate, and again, going back to the communications and the messaging, is if you're only going to run 13 tests a night, just know that, I mean, you should already know that when we see these low numbers, people out here are wondering why. And when you don't give a reason why, people only speculate. And like we've been saying,
well, I think to be fair, when Crystal gets the number, she's at the Joint Information Center. That's all she's getting.
Yeah.
So she's not getting the explanations from the people.
But if I were her and I would see these low numbers, I'm going to think that people are going to wonder. So I'm going to try harder. That's all I'm saying is that And I mean, it's easy for us to sit here and second guess, but I think it's common sense. People out there are wondering, why are we being told to go another month, to follow the governor's orders? So we're doing our part. We have the power to do our part. But when you see Public Health only testing 13 people, it kind of just,
Yeah, no, I totally get you.
Yeah, okay. So let's get Sinania Mayor Robert Hoffman on the show. Always good to talk to Mayor Hoffman. Good morning, Mayor.
Good morning.
How you doing, Mayor? Reporting from Sinahanya.
reporting from Sanahanan. You're a field reporter here.
Right. So, Mayor, let's just start at the beginning. Where are the mayors at in terms of COVID-19? I know that we've been talking a lot about you guys not being in the loop. Just a status on that.
Well, one of the things we did ask a few days ago was how many more kits do we have? Do more kits arrive? I understand that some of the clinics are testing now. I believe FHP, I believe DSL Labs is able to do that. So we haven't got an answer for that yet. Well, we're still waiting to see how many more. And that can answer Chris's question of why they're only kind of doing 13. Hopefully it's because it's, as they're doing their tracing and they realize, okay, this is how many people they've been in contact with, and so this is how many we need, or are we waiting for the other labs to also start producing results? Because
it takes 5 to 7 days for the commercial testing facilities to get the results back. So people can go there, but then it takes 5 to 7 days, and so that's not counted yet.
Yeah.
The numbers that we get on a daily basis.
So it might be those people being referred there, but it is a question we raised as mayor, so we're waiting for a response for that. The other thing that we've been doing, and we were actually happy that they actually, for the grab and go for DOE, by setting the limits, we were able to feed a lot more people. We feel, and we were able to kind of get that up, and more people were able to take advantage of the program versus one car getting 20 meals or stuff like that. So it actually helped out. We saw that, and we got some satisfactory remarks from a lot of the residents who waited in line and was able to avail themselves of a meal. So that was something that we pressed on with GDOE, and then GDOE in turn set the limits, and so we're glad it kind of worked out.
Mm-hmm. We're starting to see a little bit of information about the contact tracing that's going on. Yesterday, Public Health Director Linda Norsey confirmed that there were links to what was happening at the Iglesia Ni Cristo Church.
Yes.
And early on, we didn't necessarily get a follow-up, but with the Holiday Bingo, have you gotten any additional information from Linda on any sort of links or connections to your community?
Not that we know of. Everybody that was involved, I guess, within the first wave, we all got our all clear calls on Friday, and a few days last week. I was staggered depending on what day they were at, either the center itself or whichever else. So we were actually very pleased that all of them kind of got the all clear. I actually got a call from a resident who I didn't know that they had COVID, and they called and goes, I heard you talking on KOM about the COVID. I just wanted to let you know I'm one of them. I was like, really? Okay. I did not know that. Now I know. So they are revealing themselves to us in that manner. And what, he's at SNU, and he just wanted me to check on his wife and how she's doing and stuff like that. And so we communicated with the wife. We offered her food assistance, and actually brings a great point. What we've talked about as a few mayors last night, we talked about is because some of these people are the providers for their houses, and their households, and if they end up on isolation, they're either taken away or they can't, or they end up staying home. They can't go out and get the food. So we have households where there's 5 or 6 people who are all now have to stay home because only the one person tested positive. They're waiting to see if they can test the rest of the household. But since they know that person's positive, that whole house is basically on a lockdown, so they can test everybody else. So we have families that are struggling now for food and for other things and supplies. So we were trying to figure out last night. So what do? We know you can't if you take the one individual out, you're still left with 4 minors in the house. What do we? Where do we go from here?
Are you seeing more and more people coming out, and your constituents coming to you, talking about how they're hurting during these times? And
yes, we've been getting quite a few referrals, people requesting how to apply for public assistance, and then people having questions about the stimulus package and what we can do. We've had landlords asking us how do they go about collecting rent if they can, and so it's all spectrums. We're getting the requests in, and so we're just hoping there's some solutions in that manner. I know everybody is hurting. There's still a portion of this island that's still part of the workforce that's still going out, so it's hard for them, I'm sure, to leave their families and then come back. And now with this cases with this children, this is kind of it highlights why these things are important and matters to stay.
Well, hearing the voices of your constituents and how they're hurting during these times, Have you been able to relay that and have any communications with the Joint Information Center or the governor's office?
Yeah, we requested again for the MREs for these families specifically that it's hard to tell a whole family you're going to have to stay away from everybody for the next 14 days because of one person in your household, and so that one person is well enough to stay home and not be confined to a medical facility, but that I feel it's probably better to do that is to take that person and put them out into a facility and then figure out a way to care for those 14 kids after they're tested. Wow. So I've told one of the mayors who this is happening to. I said, ask public health if they can hurry and test this whole household just so they know, because it kind of sucks that you live with that cloud over your head and you're waiting to see, and nobody else can provide for this family. So the mayor ended up stepping up and providing some canned goods and hear what they can do. But for 14 days to do that, breakfast, lunch, dinner, snacks, and whatever else needs they have, that's going to be quite daunting just for one person. So you overwhelm us in that end also. So we've asked her to we've asked them to reach out to Homeland Security to see what else can be done. What are the contingencies for this, where their home isolation and now their whole house is affected because that one person is the only one that can provide.
It all goes back to home isolation
and Mayor, with the order being extended to May 5th, we were talking yesterday about I know in a lot of people's minds they were thinking April 13th as some kind of finish line. But what are you hearing from your constituents in terms of how do we make it through the next month financially?
It is hard. Everyone's at a loss right now. One of the things we were hoping for the more serious lockdown to take effect today. That's something the mayor's asked. I said, let's have the checkpoints. Let's see these people, because we are all still seeing people gathering. I mean, over the weekend, I had 2 households in my village that had parties, and the neighbors were massively upset. And I said, call 311 and let's try to break it up. And I didn't understand why people think they're immune to it. And then you saw the video. I think it was a Gura House party the other day the Gura responded immediately to that once it was made known to them, and they issued notices to those people. But it doesn't dawn on them that they're, I know it's okay, it's just the flu or something like that. It's not just the flu. The fact that there's doctors and medical professionals who are passing away in the States from this, it's crazy. And it's crazy to just think that your discussion should be, what are your final wishes, life insurance, and
Mayor Dr. Akimoto, of course we had that conversation yesterday morning. Your end of life plans, you got to tell people what you think. And I saw on Facebook people were criticizing him, and I don't understand why. I mean, there was a comment from my friend Maria. She said, hey, what data? Well, I think the data is that 4 people have died, and this is something that we do need to consider. I mean, it's obvious COVID-19, once it gets you, I mean, you could go fast. And I think Dr. Akimoto telling people to make sure that part of your end-of-life plan is shared with your family, I thought it was very genuine of him. Yeah. And I think a lot of us had that conversation yesterday, and it's good to just let it be said, because the last thing you want is your family to be left in the lurch and no one knows what to do with you. And it's uncomfortable. It's alarming, but obviously it's real. And this is a real time, and we're just getting started with this. So,
and I feel for the people who have family that have passed away just for normal things that, either whatever course of life, and they can't have funerals, they can't have that closure, that normal, that was kind of given to everybody else. So, it sucks trying to die, if you're going to try to die around this time, or you try to get married or having a baptism. So it does put a damper on, a lot of the things that people are usual part of our culture and tradition.
Right,
so I know that's one thing, but the death part is what gets me. People still, they think it's easy. Oh, it's just 4 people out of a whole island of 170,000. Just turn on the TV. I mean, it's shocking that every day the numbers go up by 1,000 or more. And I was just watching CNN this morning, and I couldn't believe that 345,000 cases in the United States. And so
just like it happened. I mean, it seems like overnight.
Yeah, and so it's just it's alarming for us, and I think it's a wake-up call, and hopefully more people will heed that. Hopefully more businesses will say, you know what, I don't need to do the to-go delivery, or I don't need to be open to do this, and let's just hunker down and see. Because I think they said that the more people stay home, then the less people can get infected. But it has to be consistent. And
Right.
I think India, I had a graphic that I found reading. I was one of the news outlets we were reading, and India did it in India is so big, billion people, so they're trying different models of these isolations in different areas. And they're showing if it was just a 21-day, they did one where it was just so many days, and they lifted it for 5 days, and it was so many days. Then they did one that it was just staggered, and they all showed the result that saying that if you don't do it for the long term, you're gonna get the spike.
Right.
And so they kind of, I hadn't say they tested on human guinea pigs, but at least these governments can be able to now have proof saying, this is why we need to stay home.
And that's a good example for us because, like I said, we're on the last wave, and so we have everything that's gone on before us to kind of look at and learn from. Mayor, I wanted to talk real quick a story we did yesterday that was popping up in the comments. Viral pictures that went around of a funeral Saturday. This is complicated because in talking to the people who know the family, it appears that they did try and limit the number of people who showed up to this funeral. But I mean, Umatic, it's huge family, so I see all sides of it. But the side that I was concerned with was that you have a high-ranking Adelup staffer who is obviously violating the governor's social distancing order. And we had made the ask of Janella, is there going to be any, discipline? I mean, I'm not saying fine her $5,000, but do you think it's important for the people up top to kind of set the example for everyone else?
Yes, it is. And I think that the really hard part, I think, is, as anything that anybody does, it's always family first. No matter what, end of the day, family's going to be there for you. A job is a job and all these other things. So, I think that's what trumped that in thinking about that. These are their immediates on their end. So, I believe it's personal for them on their end, and whatever explanation they had, I hope it's good enough. No one's had, everyone was there for a different reason to grieve, to lose two parents. That is hard, especially having, I believe, 11 kids. That's, you already violate the social distancing rule just by having 11 kids saying, hey, which one of you don't go to the funeral? So it is hard. And these 11 kids have their spouses and their wives, and
right.
So it's.
So how do we do that, Mayor? Do we do that like 10 people go in and do the viewing, and then they go out, and then another 10? Because I mean, this is real. This is something that, and what I had a problem with is this is something that you hear it. It's so heartbreaking. Other families are adhering to these rules. I'm pretty sure they have big families too, but I just feel like we got to be consistent here. As uncomfortable as it is to talk about, and I just can't wrap my mind around the people who have COVID, they have to get buried in 24 hours. They can't see their relatives. I mean, regular deaths, and it's just a lot. It's a lot.
It is difficult. When we did we did one of the last funerals that were allowed before the number was reduced down to 10. It was 50 people, and the church was very strict about the number of people, where people sat. The funeral that I did when I first came on your show,
right,
when we first talked, they counted the number of people in the choir, the priest, the altar boy, and then the family. They said, okay, you basically have 45 slots to fill in. You basically can only have 45 family members here. You're going to space yourself out in a church which normally would sit 450 people. So people sat at distance, and so they had their funerals, and but they wore masks. And this was early March or mid-March when we did this. So these families took it very seriously, and then the burial was even more private. Not even the 45 people. They didn't have visitors. They just came in, had the mass, and then they left.
Yeah.
Easter's coming up this Sunday, and so we can only hope that people still follow the social isolation mandate and not, have parties.
Yeah, I mean, it's crazy.
Especially with all these children that are thinking, we're going to go hunt.
I think what's got to guide us, and it's so unfortunate because we're a family-oriented culture. I picked up some donnie from a friend last night. We met in the middle, and it was just awkward because you always have that inclination to go and to do the kiss and the hug, and it's like, oh no. So I mean, I think what's got to drive us is that this virus is deadly. It's so contagious, and so we just can't risk that. I mean, we've already got the elderly at risk. Now we've got kids at risk. So I think everything that we do has to be guided in trying to stop the spread of this. And I know it's Easter. We're going to get other Easters. We can do Easter after this. But I think what's really is we have the power to kind of kill this, no matter who has the authority or doesn't. I think it really sits with us, and that's why we got to take it serious.
And it showed. I think if the first cases were here, March 11, 12, 13, when they first started testing, and this disease runs 14 days course, we should have all been at zero by the end of March if everybody followed the rules and kind of did their thing. But as arrivals came, I think whenever the last arrivals were, I think, and I kind of stress it to people. The people complain about the planes. I said, there's no tourists. It's just our people coming home from spots that are hot, and so it's how do you tell people you can't come home? And so it's difficult. It's a difficult decision you have to kind of make in that end, but it's not tourists. It's not anything of that related. It's not, the governor didn't give the virus to everybody, and nobody's enjoying this at all. I think it is very stressful, and so.
What's stressful, I think, is when you saw that trajectory report last week by Dr. Felix Cabrera, and he, one of the graphs was that by June of this year, we could see 7,000 deaths, and that's only at 50%. People following the social isolation directive.
And I don't think people realize that what's happening now is not what the worst of what we're going to be going through. And I think that's why people in their mind, they're like, oh, we have 4 deaths. Oh, there's only 100 cases. Oh, but they don't understand that if you listen to the people who are on the front lines of fighting this, the timeline, I mean, we are in the beginning.
Yeah.
Right.
Yeah.
So it's important to remember that.
Because I think I saw that it takes 10 weeks total for an area to kind of have that peak and that drop, and we're on week 4. So
right.
This is the hard part. Is what does the future hold for Guam? And so, like I said, hopefully more businesses and more people see that. Try to do all your grocery shopping or all your needs in a day and not daily. There's I know people like the fresh vegetables or the fresh cut meats or something like that, but try to just stock up for a whole week or two. But it's a difficult because finances are little here and there, so they're scraping by, trying to stretch it as much as they can. Hopefully, take advantage of whatever sales they do have. But I think that's the only one. I've seen restaurants that were closed because of COVID that have reopened now, saying, "Oh, we can do it." Because everybody else is doing it.
Yeah.
So we're going the wrong way.
Yeah, Mayor, so I know that you were one of the voices that was really calling for a strict lockdown. I want to get your opinion because I value it. Over the weekend, with what we saw where there was an anticipation that a lockdown was going to be announced, it wasn't announced, and instead the governor came out and said, I need the senators to do legislation and give me a power. What was your take on all that?
We've a lot of the mayors already made our little placards for our vehicles because we have employees that we basically just said mayor's office, essential employee. A lot of them drive their POVs as we do our food deliveries or as we check up on families. So we did that, and we're hoping people if people see that, then people maybe respond and say, hey, you know what, I shouldn't be on the road. I have no real purpose. These people do. So hopefully it was kind of start a trend. One of the things we talked about as mayors is, what if we close the roads ourselves? Will they arrest us? I said, what if we block our villages completely, saying no one can go to work? We're going to beat this, but it's very difficult, and we know that's something that can't happen on our end. But it was a discussion that we had to say, hey, put up barricades, block the roads, and let's have our own little checkpoint saying where are you going. But we don't have the PPE, so we're hoping for more stricter measures in place. And if the governor says she doesn't have the power, I know that's a legislative thing. I know that I think the Vicky tried it in one of the typhoons, and then it got challenged by lawyers saying civil liberties. And at one point, they even said that if you're trying to lock it down because you don't have enough police, the Guam law allows you to assemble a militia, so use a militia. Then if it's a public health thing, I believe the public health director can actually order the roads closed, but that's a power that lies within her, not with the governor. And I think so. Maybe that's something Linda should exercise.
Yeah, they should definitely have done a better job of looking at all the options available to them.
Yeah, all the other states are having a difficult time too, but it's still early for the United States. And as much as I think they said more than 90% of the U.S. is under some form of a lockdown or a stay-at-home measure, people are still violating it.
Right. Yeah. Well, Mayor, anything else you want to add here? Just kind of a weird morning here.
Well, we're just waiting for, hopefully we can hear from the Archdiocese to find out about, I have Bishop Gartner School as one of our schools here. It's a private Catholic school. So, a lot of the students are, parents are asking me, do we hear anything from them? I know they're doing they're continuing to do some of their distance learning, but, they're all saying, hey, why don't we just, let's all just take a break, call this the summer.
Yeah,
now.
I
I actually emailed the Archdiocese, Tony Diaz, yesterday to see if Juan Flores has made any sort of decision with the private schools. But I also got an email from my son's school saying, okay, you're going to have to do this. This is homework, all this homework.
Yeah. Right. And I understand it's different because unlike the public schools, which are funded by the government, private schools really rely on the tuition, really rely on a way to pay their teachers. So if there's I got a tuition bill and I'm just like, wow.
I know, I did too.
Yeah.
I did too.
So what's up with that, guys? I mean, because that's a lot of people were telling me, private school parents are saying, hey, why are we still paying? Well, is it because you're doing the distance learning? So
I think so. I was hoping it would be reduced because we're not consuming power or resources at the school itself. But I understand the teachers kind of still need to be compensated in whichever way they don't have. They're not.
We got a reduced tuition. You guys didn't get one?
No, we didn't get one.
Bree got to connect.
No. I got the letter last night. Maybe it's in your email. Check your inbox. But I got the email.
I will check that. But I think it is, and that's why the Catholic schools are probably having a difficult time deciding about, do they just end now and just call it, or do they at least continue on till May 16? Is usually the kind of the start of the end of that whole part. But I have a daughter who's kindergarten. She's so sad that she's not going to have a graduation, and she's just thinking, am I going to? And I'm like, sorry. And she's been practicing her graduation song. She sings it like a champ. So I'm like, we'll probably do one online and call all the
send it over.
Right.
Send it over.
Zoom graduation.
Yeah, Zoom graduation, and we'll try to see what we can do there. But I feel for the class of 2020. There's no way to kind of make this up. I was telling my other kids, I said, we should just repeat this whole school year one more time for everybody's sake.
Wow.
Because then my one daughter's like, I'm going to graduate when I'm 19. No, I'm like, at least you have a ceremony better than graduating when everybody's going to be dead or something.
Yeah. Oh, Lord.
I said, just trade it one more year. It's kind of do over 2020 and let's skip it already.
Yeah, this distance learning stuff, though, like with my son, goodness gracious, because I get off really late, and then I got to be a teacher for him in terms of like, okay, did you do your social studies, science, math? Class dojo.
Specific time. I'm like, oh yeah, it's like I had to learn so many other technologies in the past months. So
and I got to pay tuition for it's.
All right, welcome to the parent griping hour.
Yeah.
No,
I got to do a project.
Yeah. You're not supposed to do the project, Bree.
No, I'm talking about helping.
She's one of these moms who are like, yeah, I got a science project, dude.
No, I think those teachers, God bless them for trying to be creative and get out there and do what they can. I know they miss their kids as much as we do on getting out there. And so I saw a meme last night kind of made funny. It says, oh, you wanted the weekend to last forever? How'd you liking it now? And that made me really laugh.
How you like it now? Yeah, thank God for some of these memes, man. That's keeping a lot of us alive right now. Okay.
The Tiger King and
the Tiger King. Chris has a Tiger King one. We got to see yours, Mayor.
Yeah.
Oh yeah. Sure. We'll send it to each other.
Put it in the chat.
There you go. Well,
thank you, Mayor.
Have a great morning.
You too.
All right. Take care.
Right on.
Be safe. Bye bye.
There you go. Our man in Sinanya. KUAM, a temporary honorary correspondent.
He's so good.
Mayor Robert Hoffman. Yeah, he's got the institutional knowledge. He's been around the block, different administrations, so it's always good to get his perspective in here. 7:09. Bree really got to go to the bathroom, so we're going to take a break, and we're going to come back with Tomas Manglotnia to give us a situation that's going on in the CNMI. Remember, the latest from the Joint Information Center, they tested 13
tests
last night, one positive. Okay.
And don't think that's, it's only one.
Right.
There were only 13 tests that were run, so and I think we're at 112 confirmed cases.
Yeah, and so we'll get to that at 7:09, where KUAM FM in Agatna, Guam, containing COVID. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Specialist Joshua Mancinotnia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy.
and I can't wait to see him. So keep us safe and stay home. Dab.
"17 more positives were confirmed Sunday night, and 6 of those cases now include our youngest residents. Public Health Director Linda DeNorsi.
Of course, that was a 1-year-old individual. It's a baby, of course, and it was due to a household contact. In regards to the 10 to the 19-year-old age range, there were 5. And of the 5, 3 are household contacts. 1 was travel related from Honolulu, and the other one was a social event where they got the infection. It is troubling, and it's just a demonstration again that the COVID virus does not discriminate against age, sex, ethnicity. It is through all socioeconomic statuses. It's a virus, and it doesn't. It's not selective.
The governor adds that unless the public steps up and takes the isolation measures more seriously, the numbers will continue to climb.
I ask the people of Guam again to please abide and comply with these measures. It is very crucial that we do this as we are starting to see more increases in our cases. And the only way that we can decrease these cases, the only way that we can eradicate these cases is through social distancing, through staying home, through decreasing social contact, and so forth.
Meanwhile, the governor has asked senators for legislation authorizing a curfew for all and checkpoints to limit unnecessary travel. But at the media briefing, she said she's not heard back from them when session will be held. For Guam's News Network, I'm Nestor Lecanto.
Top of the day, Guam. This is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay home and stop the spread of the virus. Thank you.
They're a collective of undergraduate students from the University of Guam and Penn Foster College, aimed at helping the community during difficult times. Alana Fergerger, who handles social media engagement, explains the meaning behind the name Wonder Kid Project.
The Wonder Kid name itself is meant to represent hope and admiration. Going with the superhero-esque name, everyone who takes part in our mission, we hope, finds the superhero within them to give opportunity for the community to admire.
According to Point of Contact for Family Assistance, Maria Minas, with the COVID-19 pandemic taking a large toll on the island's healthcare system and affecting the lives of many, the team had a fundraising idea for a startup project to kickstart their mission.
This is a crowdfunding project for our local community on Guam who are heavily affected by the COVID-19 pandemic, such as our frontliners and families facing extreme poverty. Specifically, our main beneficiaries include the Guam Memorial Hospital Volunteers Association, Guam Harvest House, and St. Dominic's. And through your generosity, your donations can help purchase supplies such as masks, disinfectants, and food.
To date, the group has raised a little over $1,200. Project coordinator Aries J. Moreno.
I understand that it's a very difficult time for everyone, so if you would like to donate, you can go ahead and visit our GoFundMe page through our social media platforms, or you can actually go straight to GoFundMe and find the Wonder Kid Project Guam COVID-19 Relief and donate through there. And if you don't have the means to donate, that's okay. You can go ahead and just share our information through your friends and families.
If you would like to know more, you can follow them on Instagram at The Wonder Kid Project or email them at info.thewonderkidproject@gmail.com. Reporting for Guam's News Network, I'm Jonah Goncharfris.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could
this guy. I knew Jason J before he had hair in his fat Windward Hills.
Hey, and he's going to be, we hear that he's going to be on Live Local Friday this Friday.
Yeah, so, man, that was a great show. We did a Stay Home Live Local Fridays. It was like living room Live Local Fridays.
Yeah, it was awesome.
So many amazing local artists on this island, and so many amazing local artists from this island that are out there, and they were able to do the music little performances. We put them all together, and we're doing it again this Friday.
Yep. So as Chris was mentioning, we're going to have Jason J. He's talked to Jonah Goncharfris and said that he would be sending in a performance along with Chris Boomer.
Nice. And then we've got Annette Geff Pagu and
Matt Laguatnia?
Matt Laguatnia, who's going to be mailing his performance in from Afghanistan. And I believe we're also going to have Fat Tofu. I reached out to Fat Tofu. Wow. Okay, so thanks. And hey, we're going to be doing this for...
You're performing too. That's what I heard.
Oh, I guess I am. So we're going to be doing this it's going to be, we're going all the way to May 5th with this. So any artists out there, we're all over the social media. Shoot us a message if you want to do a cool video. It's a great way to get your music out to the people of Guam. And I don't know if you ever heard the term captive audience, but that's definitely what we have.
I do want to, before we get it to our caller, I just wanted to give a shout out to a lot of the people that are posting comments on our Facebook stream. And Rosalind Aguero Cruz, I gotta say this, she says Bree's a cutie and Chris is a sweet popsicle on a stick.
Nice. Actually, Rosalind, you kind of been making my day here. I saved her. She had a comment yesterday. Where is that here?
Making his day. Aw.
Well, at my age and my looks, we'll take what we can get. What was it? It was something like man meat on a stick or something very classy like that. I can't find it now, but...
you can get away with these things when we're all socially distanced.
Man meat on a stick.
That's pretty...
You heard him, Rosalind. It makes his day.
Yeah.
So keep him coming.
Don't overdo it, though. 718. Let's go to the phones. We got Joe on the line here. Hey, the number 637-0094. Good morning, Joe.
Hi, good morning, Chris.
Hey,
and
Joe.
Sabrina, Judy, and popsicle stick, I guess.
Popsicle stick.
I'm like a big chunky ice cookie.
Yeah, I got to echo that comment on your Facebook page, but I don't know about man meat, buddy.
Yeah, okay. That's where we draw the line. So what's on your mind, Joe?
Hey, listen, thanks for entertaining our private residential call, but I know you guys are yielding to the leaders and the medical community.
Always want to hear from the people, man. I'd rather have it that we hear from the people. But the thing is, the leaders and the officials have the information that we need to get out to you guys.
That's right, and I appreciate that. And that brings me to, I only have 3 points if I could just express my opinion.
Sure.
Yeah, let's go.
Yeah, the first one, right off the bat, since this whole thing started and when DOE came out with their, announcement about the meals program, This kind of concerns me, and I'm sure it concerns a lot of parents and residents out there. But now that we know that the kids are being infected, I think they need to really seriously take a look at this program. How do we know that it's really not coming from the meals being prepared? So that hasn't been really proven. All we know from the press release is that these tests are by contact, by travel, but how are they being contacted is what's not provided. So I wish that they would seriously consider and seize that operation for the sake of the kids. And my second issue is, related to the data that they report, I think it's time. The mayors have been pleading with this government to release that important information. And in particular, I'm requesting the governor and public health release the data of the villages that have been infected. That's important. You don't have to release names, but I think it's time that the villages are aware. And you know what? There's a positive effect to this. It may curtail people from leaving their homes knowing that their villages are in fact infected. So that's the positive thing. It may allow people to help and contribute towards to stay at home and keep safe.
Can I ask you this, Joe? What would your response be then if they were to come back and they tell you, well, you should just act like it's everywhere?
Because that's what they're saying. They're saying that act like everyone has it. Stay home. When you start to get really sick, call your doctor.
Yeah, well, you know what? When they tell us that right away, my impression is that there's blind leading the blind. We're walking into a dark area that we don't even know. We can't smell, sense, touch. It's ridiculous. I am just pleading that they release no names. No need to get personal with that. That's understandable.
Mm-hmm.
But I think, by village district, numbers of infected, I think it goes a long way, and it's going to provide a positive, stimulating effect to the people. And if that news doesn't curtail them to remain isolated, I don't know what will. And then my last point is, regarding the platforms for communication, I am so happy to be able to come in and you allowing me to voice my concern. I just wish there was another way where we can communicate via the platforms that you guys have, because I think the public input is just as important as our leaders.
Of course, yeah. We'll hear you, Joe.
Let me end that with, saying our grateful thanks to all those that are helping to keep us safe. Thanks to all of the medical people, the firefighters, law enforcement. All of those people deserve huge kudos to our medical community. And most of all, and last but not least, to you guys. Without you, who knows where we'd be today. So thank you, Sabrina, Jason, and Manmeat.
Thank you, Joe.
All right.
Thank you.
Live that down, Chris.
Yeah, I got it. I kind of like it. Has a ring to it. Okay.
Thank you. Take care. Feel free to call anytime.
You call anytime, sir. Okay. Bye. Now, there you go, Joe. Yeah, I think it's, we keep seeing in the comments that people say, oh, well, South Korea did this. Well, newsflash, we're not South Korea, and we just don't have the means to do the massive testing that everyone's talking about, but I understand how people feel that, hey, go home, stay home. When you start to get really sick, call us. I mean, it's a little, but that's what we got to do. I mean, that's the reality of the situation. And I think what Joe said was very true, that the people of Guam, when you go to the doctor, you don't want the doctor to dance around the details, right? The doctor is going to give it to you straight. You got to quit smoking. You got to change your eating. This is what you're going to do. That's where we're at. The people of Guam, we want the straight story. Give us as much information as you can, and we'll deal with it. And I think that's really where we are now. And so,
do you want to know which village?
I do want to know. We've been saying this, Bree. I think we're the first people to say it. Then the mayors were telling us, and then we had the doctors chiming in.
What about you, Jay?
Because I think, Jay, if people know that, there's, for example, X amount of cases in Jigo or X amount of cases in Dedido, what's the effect of that? I think people know that it's close to home and they're going to stay home.
And that is something that people have been bringing up from the very beginning is,
Right.
when Sabrina and I actually did the live stream of the governor's first press conference when we could still go out in the field and we were at Civil Defense and they
Right.
announced the first 3 COVID cases. People were like, okay, we want to know where they're from. And even people that aren't familiar with public policy, they're like, okay, I know what HIPAA is vaguely, and I know you can't name them and you can't specifically put their names and their faces out there on Facebook. However, I want to know at least roughly what village they are. Now, and one thing that's been kind of percolating in my mind, I wanted to ask the two of you, right, is by virtue of our work, right, the 3 of us would be considered public figures, right? Certainly the 2 of you way more than I am, right? But knock on wood, if the 3 of us were to contract coronavirus, right, knowing that you are a public figure, and especially Chris, you've got a lot of celebrity to yourself, right?
As man meat.
Yeah. Would you go public?
Of course.
Yeah.
Yeah. I think that people who are, but also I was thinking about this, like if you have COVID and you go public with it and you share your story, there's also that side of it where if you're not like hospitalized or you're just asymptomatic and you're kind of putting out this message like, oh, this is COVID-19, oh, big deal. I feel.
And I think
that could be very damaging.
And I think a lot of people are worried that if they were to announce this, that people would come after them, or people would,
who's going to come after somebody from 6 feet away?
Or people would treat them like a leper. And we're not trying to compare 1-to-1.
I think they should be, and that we let's all stay away. We should all be treating each other like lepers.
Yeah. But what's interesting is I was thinking back to when the coronavirus on a global scale first started happening. We're all sports fans here, and when Rudy Gobert, the NBA Defensive Player of the Year, first time All-Star finally this year, when it was announced that he actually had it, that he was the first NBA player to contract coronavirus, he didn't actually say it himself. It was ESPN who broke the story, so they outed him.
Yeah,
and they said because of his celebrity status, if you are someone of a public figure, does the public have the right to know?
But we're talking about villages, Jason.
Yeah. No, but like Tom Hanks and his wife, when they were on vacation in Australia, they actually came out and they said, hey, FYI, we have it. We're adhering to all of our doctor's orders. We're being taken care of very well, but we just want to let people know because, on that level, somebody's going to say it. But I think that is very big of you if you would say if you had it as a means of taking care of our community, which has always been big with you, you would actually proactively, you would disclose that.
Yeah, but I also feel like if you're going to go public with it and you're going to be talking about it in a way where it's like, oh, this is, well, it's not as bad as whatever, then just don't publicize it. Because I think the message has to be, very clear that this is life and death.
And there is a lot of that too,
right,
where people are like,
Okay. Want to go CNMI now?
So, wait, you
ahead.
didn't say, do you think people should know what villages?
I would actually think that is a really good thing if you at least break it down by village, because people are even saying, can I get the specific street or your cul-de-sac?
Yeah,
or
no,
your
that's
court?
a little too.
Just villages.
You don't want to like laser lock in on somebody's particular.
Yeah, because I don't think I don't think HIPAA is a justification for that.
But I even think the mayors would appreciate that because we've been talking about transparency and how much they know. If
we know they'd appreciate it.
Yeah. If they just said, hey, for every village there's X number of cases and everything, you can further lock down and emphasize to your own constituents, hey, you guys really got to take this seriously.
Right. I wonder if that's something that they're going to continue to ask, and I wonder if that's something that public health and the governor and her team are going to budge on. Right. Okay.
They did it for dengue.
Right.
They did it for dengue, but they won't do it for this. It just
that's crazy, and this is way worse.
Yeah.
Yeah. 7:29. Let's get Tomas Manglotnia on the phone here from the CNMI. He is on Saipan reporting on the latest with COVID-19. Good morning, Tomas.
Good morning, Chris and Brady. Jason, how's it going?
So what's going on over there? We haven't heard a whole lot in terms of like results or anything. Is the Guam lab not running tests for you guys?
Yeah, and so we got some new information yesterday from the CNMI Governor's Office and the COVID-19 Task Force. And so according to Press Secretary Kevin Bautista, we received 3 results over the last few days, all of which were negative. There's a delay in getting results, he says, because Guam is backed up with a lot of tests. Now, this isn't clear if there are more people under investigation or any pending specimen other than the 9 we initially heard of last week. The governor's office also told me that they're going to start sending specimen or continue sending specimen to Hawaii to expedite the results. The timeline for on-island testing still stands with us, still stands with the hospital and the task force having capacity by late April or early May. They also launched a new hotline yesterday that I wanted to share for folks. You can call to get general information and non-medical inquiries about the CNMI COVID-19 response from 7 a.m. to 7 p.m. Monday to Sunday, and that number is 670-287-0046. And again, that's for general info and non-medical inquiries. Chris and Bray might as well call that number too to get some updates. We haven't had a press conference since that last Monday.
What was that number again?
The number is 670-287-0046. General information and non-medical inquiries about the COVID-19 response. We're hoping for them to start the daily press briefing soon. I know they were working out some kinks with Zoom. But
they should network with Adloop and they do a little tutorial.
We're hoping to hear from them soon, and I think I think you both also got the press release about the 118 individual travelers being released from the COVID-19 quarantine facility this week on Saipan. So that's another big news making here in the CNMI.
They're the ones that were in Kanoa Resort.
I believe Kanoa Resort and a few of them were transferred to the Pacific Islands Club. Similar to Guam, we're still unclear about where everyone's exactly at. We do know that no home isolations are happening, but other than that, that's the latest we have. And again, we really hope to have the daily press briefing soon to ask all the questions that we need to. Hopefully, more than 2 questions.
Tommaso, are they just basically saying that, hey, we're busy, trying to establish the front line, how we're going to deal with COVID-19, and we'll get to the press conference later, or is it just, wall?
I think, it's a busy time. Everyone's busy, but I think a lot of folks do want to hear from the task force, and we're hoping to get that set up. Every day I've asked, is there a press conference today? I know even, Adriana has asked, and so we're hoping that when that happens, and it's not just questions for us. Again, it's for the public. So we want to know more.
Right.
All right, Tomas.
Good job. Anything there in closing, Tomas?
Not much other than got to reiterate the support to the frontliners, even here on Saipan, Tinian, Rota, all who are keeping our community safe, and it seems like we're going to be in this for a while now, so hoping everyone stays as positive as can be and stays well and stays home.
I did, I just remembered that during the press conference yesterday, Public Health Director Linda Pingo DeNorsi, a question was asked about the Iglesia Ni Cristo Church, and she basically confirmed that there was some sort of a connection between the positive patients, I think it was the first 2 positive patients in the CNMI, to this church.
Yeah, and I did mention yesterday, I did talk to one of the members of the faith-based organization about a week ago, and they mentioned that they were being screened. I'm not sure if any tests were done with them, but I do know that a member of the faith-based organization, members of those organizations were tested, and this one person was there at that service. Okay. And so we're waiting to hear more from that. It's interesting to get news from Guam about what's happening on island, because I honestly watch the Guam briefings to find out what's happening here.
Right,
so thanks for asking those questions for us too, Chris.
Of course.
We should probably see if you can get in on those briefings if you have time. I know you're studying too, so.
Yeah.
But thank you, Tomas, for your time and covering what's happening over there. And I know that you were trying to secure an interview with the mayor of Rota. So we're looking forward to that.
And, hopefully also some local doctors here who can speak to the exact situation in the CNMI and what precautions people can take in Saipan and Rota and Tinian.
Okay. Thanks a lot. You take care. Be safe.
Thank you. You too.
Okay. Bye. And that was Tomas Manglotnia. Hey, Chris, can you... So that was Tomas Manglotnia. He's a...
Sorry.
He was on the phone.
Yeah, I know.
He was on the phone. But yeah, that was Tomas Manglotnia. He is... covering for us the happenings and the goings on in Saipan, Rota, and Tinian. He actually did an interview last week with the mayor, right? The mayor of Tinian, which is posted on our Facebook page.
Yeah, the mayor of Tinian, the Honorable Edward Aldan, and very, very good. You know, he's known Tomas since Tomas was like a young boy, and the conversation was very honest. It was also very it was very authoritative. It was very official, but it was also very like laid back. And the mayor is working really hard up there. And he said not just because the islands of the Marianas are geographically separated, but he's like, you know, there's a lot of things that they're all trying to coordinate and they're trying to do. But he says he talks to our governor on an almost daily basis. He's also networked with legislators out in Hawaii, and he said he was blown away when he saw what Hawaii did, which what we are now doing is imposing that fine of up to $5,000.
We need authority to do that.
Yeah.
So the governor needs legal authority to do that.
Yeah, but Mayor Aldan in Tinian, he was like, wow. He goes, you know, they're working really hard up there.
Yeah. All right.
Okay.
Thanks, Jace.
We're going to go to the phones here, 637-0094. We're also going to read off some of the comments of Vice Speaker Tilina Nelson and Senator Tello Taitagui also coming on a little bit later. And Ken Lujan from the Small Business Administration is coming on at 9. I know that there's a lot of questions about the SBA loans that are available. So, we asked Ken to come on and kind of guide you guys and sort through that. Yeah.
There's a lot. There's the Paycheck
Protection
Protection Program.
Right, yeah.
And then there's another loan program that I'm not familiar with.
Right, and so we're going to get Ken on because guess what? He is very familiar with all of those programs.
Thank goodness.
But now let's go to the phones. You know, something I saw on Facebook, on Father Paul Goffigan's Facebook, and I wanted to bring him on to kind of share this as a post made on Friday. Today, the Ara Mathia Society buried 8 unclaimed bodies from the GMH morgue. Please pray for these individuals who have no one to pray for them. We'll bury another 2 after Holy Week. We ask for anything you can do to help us perform this wonderful work of mercy. We need lumber and plywood to make coffins, nails, and some money to buy a burial plot at Limtiaco Cemetery. Eternal rest grant unto them, O Lord, and may your perpetual light shine upon them. May they rest in peace. Amen. And so, Jay, I don't know if I can send you this post, maybe a screenshot or something. But we have Father Paul Goffigan on the line now. Good morning, Father.
Good morning, everybody.
Hi.
Hi there.
First of all, I guess we'll just start with this post. Tell us about this, the program that you guys do. We've heard about it, but in light of the COVID-19, how has that affected what the good work that you do in putting these unclaimed bodies to rest?
Okay, first of all, the Arimathea Society, which is named after Saint Joseph of Arimathea, when Jesus was hung on the cross, he was the one that went to Pilate and asked if he can take Jesus' body down and give him a proper burial. So the Arimathea Society here in Guam was really started by Adrian Cruz. And what we do, our main mission really is to go and bury the dead, especially the unclaimed bodies over at the Guam Memorial Hospital, or any hospital for that matter, to really give them a proper burial. A lot of these, the hospital has given the families or the next of kin, I think a year to claim the bodies. So these are bodies that have not been claimed for over a year.
Wow.
And so it really behooves us as Christians to do a work of mercy for these individuals, to give them a proper burial, whether they're Christian or not.
Mm-hmm.
We just want to give them a proper burial. You asked about how does the COVID-19 affect us? It affects us a lot, because usually we like to offer a mass for the dead, for all of them.
Mm-hmm.
And we gather as a community to do an office for the dead. That's a liturgical liturgy of the hours, a prayer for them, singing psalms, and then we offer a mass for them, and then we process over to Limtiaco Cemetery. I want to clarify, I was corrected by Mr. Adrian Cruz that the plots over at Limtiaco Cemetery are given to us. But the last time we buried, these 8 individuals, we had to fit three adults into one plot. So there are 3 people that are buried in one plot. One of them, thankfully, was a veterans. So the veteran cemetery does get involved with these individuals if they can verify their eligibility as a veteran. We can take them to the veteran cemetery and give them a proper burial there.
Mm-hmm.
But one of them was a child, and that would really broke our heart.
Unclaimed?
Unclaimed, yes, a child that was unclaimed. So and so we really just need materials to build, a pauper's coffin, and it's very, very simple. There are no bells and whistles on the coffins, but the point is just to give them a proper burial.
So you buried 8, and then you have 2 more this week.
Yeah, we have 2 next, not during Holy Week.
But after Holy Week.
After Holy Week, we are going to bury 2, I believe, on Tuesday. And I thank the Vice Mayor of Chico, who has come forward and volunteered to make those coffins.
How many are there?
It all depends. It all depends on. I think we had to clear out the morgue.
Right.
I was thinking that, Father, is that this is because we are anticipating that the morgue could become full of casualties of COVID.
And you could imagine that there might be some unclaimed bodies too, those who are going to be, probably victims of COVID-19. So there might be unclaimed bodies, so there might be more unclaimed burials to do. We don't know.
Right. Father, I want to ask, because obviously the biggest question on people's mind is, why are these bodies unclaimed?
Probably because people don't want them. The families have rejected them. There was one person there. We're not supposed to give the identity of these victims, but I've always wondered. I don't know if you remember this African American man that would be sitting on the side of the intersection, going, from Marine Corps Drive, making a left into NCS Road, and he is a homeless man who was there. He pitched his tent there, and he was always there. People were very nice to him. People were always coming to give him food, and for the longest time, I always wondered what happened to him. And I believe we buried him this past week. So it's probably a lot of them are homeless.
Yeah, but the
like
child?
Yeah, Father, what can you tell us about this unclaimed child?
I cannot divulge that information. Again, a lot of this is really confidential.
Father, does economics play a part at all in any of this, where you have someone who has a family member who dies and they just don't have the means?
It might play a part of this, but I want people out there to know that to bury the dead, if you don't have the means, please come forward, and because when the community gathers around you, it's beautiful how the community just comes together, and this is who we are. Never did I ever suspect that we as a Chamorro community, as a Guamanian community, would ever have homeless people to begin with. And never would I, even in my wildest imagination, that we would have, because among these 8 people, 2 of them were Chamorro, and never in my wildest imagination would I even think that we would even reject our own. So we need to get the word out there that we must bury the dead, and this also for people who are going to have their loved ones cremated. We need to make sure that, and if they're Catholic, we need to make sure that we bless their bodies first. Because we do believe in the resurrection of the body on the last day. So we must bless the body first if you're going to have your loved one cremated. Because it's interesting, because a lot of times in our minds we think that cremation is the cheapest way to go, but it's really not that cheap. I mean, that's why we need to bury the bodies. Especially these unclaimed bodies. It's cheaper. Thank God that Liberty Alcor Cemetery, that the government is giving us some plots to bury them with, but it is very expensive to cremate bodies.
It's about $900 and up.
Yeah. So it's either way, it's not cheap. It costs money, but that's no reason for us as a Christian community to just turn our heads to the side.
Father, what I've heard is sometimes families, they don't have the means to bury these. And they don't want to go to the hospital because they don't know what's going to happen if they're going to get stuck with a bill or.
That is the reality of today, and this is where we need to. Our government needs to come in and look for these people, these indigents who have no money, who have no place to, and like you said, Chris, who don't go to the hospital to get care. I used to work for the University of California Medical Center, and I used to work in the business office. And I told our CFO one time, it's a lot cheaper for the hospital to care for these people than for us to take them into the ICU where they last, they stay in the ICU for months. It's a lot cheaper for us to do something to maintain their health than for them to come into the emergency room or to the ICU and rack up a real big bill. So I guess healthcare maintenance should be on the top of the list for some of our elected leaders, especially when it comes to healthcare. And healthcare is not a privilege. Healthcare should be a right for everybody.
So these are the discussions you're having with the government to help clear out the morgue?
Yes.
And again, you can't say how many more bodies are up there that are unclaimed?
All I know is because Mr. Agent Cruz is the one. He's the one that makes the arrangements. All I know that he informed me about 2 more, and I said we can't bury people during Holy Week,
right?
But we can do it after Easter. So next Tuesday will be the burial date.
Was this child Chamorro?
No, the child was not Chamorro. So,
Father, is there anything else you want to ask about this, Bree?
Yeah, where do people make the donation?
How do we do this? Because, I mean...
the Arimathea Society has a Facebook page, so you can go and look for the Arimathea Society of Guam. There's a Facebook page there, and I believe Mr. Agent Cruz has already established a PayPal for that's on the page. So there is a link that can link you to PayPal if you want to make donations. I really would like to thank a lot of donors that came up, especially after I posted the post on Facebook.
Right.
People, really came out and wanted to help. And this really is, is the true Guam that we all know. It's the true Guam that we continue to be, especially during these dark times in our lives.
Father, I wanted to ask you about Holy Week. Sorry. And this is a time when, people are just so into the faith. I grew up, Holy Week is a lot of, a lot of memories for me, growing up and having to be quiet and getting that spanking on Easter Sunday.
Actually, Holy Saturday.
Right, so it's tough, man, and you have people out there who are, of course, ever faithful, but, there's a lot of people who we're offering the masses, but I feel like a lot of the flock is wandering right now.
It's very painful also for all the priests, all the clergy, but most especially the priests who go in and celebrate their quote-unquote private masses. I mean, on one hand, I really miss everybody, and it's very sad that we cannot have any kind of social gathering, just because we want to stop the spread of this virus, and we're just asking the people to remain in the faith, stay strong in the faith. All of this will pass, and this is real. Like I always told people, being a Christian is not for the faint-hearted. Being a Christian, especially to have that deep faith in our hearts, the deep faith that Christ has given us, to have it deeply rooted, so that whatever darkness comes our way, we know that Jesus is always there. And this is what we need to hang on to, because all of this is, will pass. And the Lord is trying to show, hopefully by Easter, maybe, the miracle would happen and we'll find some kind of a cure or a vaccine for this. But we need to stay strong. And we need to, and I know how difficult it is, especially for me. I would never, ever deny anybody a funeral, but it's very, very difficult for me as a priest to tell the family, I'm sorry, we cannot have a mass for your loved one. We can only go to the burial site and do a burial there. But afterwards, we can have a memorial for all those who have died during this time of COVID-19. Have a wonderful memorial for them. But in the meantime, we need to stay strong. We need to stay home. We need to stay safe so that we can stop this spread of this virus.
Thank you, Father Paul.
You're welcome.
We posted the Facebook page where you can make your donation. Again, that was Father Paul Goffin. Thank you again.
Thank you so much.
And take care.
Thank you, Father Paul. I mean, this time, any priest that we can get on the radio, I think that people need to hear your voice. I mean, especially you. You were just so popular with the people.
Well, everyone is in my prayer, and I'm available for Mass every morning at 6 a.m. on Our Lady of Lourdes Catholic Church, Jigo, Guam, Facebook.
All right.
So I still want to keep it, quote unquote, in touch with the people.
Right.
But we have to be very creative and be very resourceful in how we can continue to bring the gospel, the good news to the world, especially to our people in Guam.
Father Paul, it's got to be something for you too to be up there and look out, out to an empty church.
Mm-hmm.
It really is. But you know what? It's so funny because I can experience God. Here I am by myself in the church celebrating Mass. I can't see who's out there celebrating with me, but I know they're out there. It's the same thing with God. We can't see God, but when we have faith, we know that He's there. We know that He's listening to us. We know that He's responding to our every dialogue. So this is a learning experience for me too, and a very spiritual growth, a spiritual edification for me to really to enjoy the Mass, knowing that the people are out there. They're not physically in the church, but I know they're out there, and that we need to reach out to as many as we can. So during this time of quarantine and social isolation, I think we should take advantage. To every single darkness, there's always some kind of silver lining, and I think the silver lining is a time for us to really be with God and to be with our family, enjoy each other. Never ever take each other for granted. Never ever to take life for granted. Every breath that we breathe is a gift, is grace from God. The ability to get up and to walk is a grace from God. The ability to even go out of our buildings and not be afraid is a grace. So everything is grace, and this is one of the things that I've learned in my priesthood, priesthood of Christ, that I've learned is and that always really was on the top of my mind as I grew in spirituality, is what is grace? And I could never understand what grace is. But grace is just this free gift from God. He gives it to us freely, wholeheartedly, and abundantly. And we, even in the darkness, He continues to pour out His blessings on us. We just need to open our eyes, open our ears, open our minds to see through the darkness that underneath it all, the grace of God is still there.
Thank you, Father Paul.
You're very welcome.
Man, God bless
my number
you.
if you need to call me, okay?
Okay,
God
I
bless
will.
you all.
Thank you.
Okay, bye-bye. Bye-bye now.
That was Father Paul Kofigan. He posted over the weekend that the Arimathea Society, they buried 8 unclaimed bodies from the GMH morgue. One of them was a child. He wrote that, please pray for these individuals who have no one to pray for them. We will bury another 2 after Holy Week. We ask for anything you can do to help us perform this wonderful work of mercy. We need lumber and plywood to make coffins, nails, and some money to buy a burial plot at Limtiaco Cemetery. And so we posted the Facebook link to the Arimathea Society if you would like to make a donation. And so what they're doing is they are moving out these unclaimed bodies out of the GMH morgue.
Yeah, that to me, that's, I mean, you see stories, I don't know if it was Italy or Spain, but they're just overwhelmed with bodies. They had to convert an ice skating rink into a, makeshift morgue. There was something else I read yesterday about, I don't know where it was, but they're having curbside funerals because there's just so many bodies. So people are standing at the curb and doing a little prayer, and then hearse is off, and then the next one pulls up, and it's just, 7:54, I think we got to go. I got to get me a Kleenex. Sorry, man, it's just a lot, and I think we're all trying to process it. We hear this a lot, be strong, but yeah, you're going to break if you try and be too strong. So it's important to take those moments to just kind of let it out, and thanks for letting it out with us. It's Containing COVID, KUAM News, 7:54.
KUAM News. GU Self Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Howdy everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat, or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News. 17 more positives were confirmed Sunday night, and 6 of those cases now include our youngest residents. Public Health Director Linda DeNorsi.
Of course, that was a 1-year-old individual. It's a baby, of course, and it was due to a household contact. In regards to the 10 to the 19-year-old age range, there were 5. And of the 5, 3 are household contacts. 1 was travel-related from Honolulu, and the other one was a social event where they got the infection.
It is troubling, and it's just a demonstration again that the COVID virus does not discriminate against age, sex, ethnicity. It is through all socioeconomic statuses. It's a virus, and it doesn't. It's not selective.
The governor adds that unless the public steps up and takes the isolation measures more seriously, the numbers will continue to climb.
I ask the people of Guam again to please abide and comply with these measures. It is very crucial that we do this as we are starting to see more increases in our cases. And the only way that we can decrease these cases, the only way that we can eradicate these cases is through social distancing, through staying home, through decreasing social contact, and so forth.
Meanwhile, the governor has asked senators for legislation authorizing a curfew for all and checkpoints to limit unnecessary travel. But at the media briefing, she said she's not heard back from them when session will be held. For Guam's News Network, I'm Nestor Lecanto.
Hoffaday, I'm Jonah Goncharfris, senior producer for KUAM News. And I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home. To protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home. Make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
When your boyfriend goes away, he's not thinking about you anyway. No, maybe for the first couple
8 o'clock.
days,
Containing COVID. KUM News. Thank you guys so much for listening. We're 93.9 on your FM dial. And, of course, live on the KUM News Facebook page. Always a lot of info coming out on the show at 9 o'clock. We're going to go SBA with Ken Lujan to kind of sort through the application process.
Mm-hmm.
And we're also going to get Guam Banking Association to talk about the Paycheck Protection Program. It's 8:01 now, and want to bring Vice Speaker Talina Nelson onto the show. Good morning, Vice.
Hi, good morning,
Good
Chris.
morning.
Good morning, Ree.
Good morning.
That was an interesting song you played.
Yeah, that's my buddy Duome. It's basically, he wrote it for his daughter, and he was saying that, hey, when you grow up and you start dating guys, just know that all the guys are scumbags, and you still got your dad. I mean, you know.
That's a good note.
Yeah, it's a Cliff's Note version.
Is that going out to anybody in particular?
Well, he wrote it for his daughter.
No.
Yeah, I got you.
You got
No
me.
comment.
Yeah.
Anyways.
Go
No, thank you
ahead.
for having me on the line. I really, I just wanted to advocate for our nurses at this time.
Mm-hmm.
I spoke with several of them the other day, and really, it's a struggle for them. And so I wrote a letter to the governor asking her to provide lodging accommodations for them so that they are able to perform their job and also rest with peace in mind that they're not bringing the possibility of the coronavirus back home to their families and their young children. And, these nurses are exposed 12 hours a day or more to the virus. And it's just, we want to make sure that they're taken care of in this battlefield that they are responding to in our front lines, and also to have an equity of pay for our nurses. Some nurses that are employed full-time at GMH are receiving benefits that other nurses who are being tasked or detailed to other hospitals and other locations responding to the virus are not getting an equitable amount of pay.
Mm-hmm.
And so really, I just want to advocate for them and thank them for the hard work that they are doing. When we go to war, all of our morale and welfare is taken care of. Our lodging is taken care of. Our meals are taken care of. Our pay is always right. So we don't have to worry about those things. We could focus on the mission. And I'm imploring that the governor will allow this same recompense for these nurses, because we want them to focus on the mission without having to worry about all the other things that come with just having a family and outside of their job, the difficulties that they would have to face. And so really, I'd like to thank the nurses for the hard work that they're doing, going in every day. And I know it's exhausting. I mean, I talked to some of them, and they're very God-fearing people. They do their work, keeping God in mind. It's a very giving of yourself kind of job. And I want to thank them for the work that they're doing, and hopefully we can see something fast, maybe today or tomorrow, where they're given accommodations and there's that equity and pay for them as they respond to this, to the virus, to this invisible enemy that we are all facing today.
Vice Speaker, have you had any response from the governor, about your letter?
I haven't seen anything yet. I know she's busy with a lot of things, but there are the directors and the superintendents that can work out these issues for the governor. I mean, that's the purpose of the cabinet, and that's the purpose of having a chief of staff. And so really these small things, while the governor looks at the big picture, these small things the chief of staff can enact, of course, with discussion with the governor to see this come into realization. And so I hope that they would act on it soon. These people are working every day. They don't have any breaks. And one of them told me they go to sleep crying because that's the only way that they can deal with the stress and the impacts of the family, of them having to come home and bring it home, and so just so that they don't have to worry about these things, that they know that they're being taken care of. The people of Guam see the hard work you are doing. The community is behind you on this. This is something we need to do and do yesterday to put their mind at ease so that they can perform 110% at their job.
Vice, logistically, how would this work? Would this be something? I'm just thinking because I haven't seen the plan. Maybe with hotels. I mean, we've seen we're housing sailors in hotels. We're housing travelers in hotels. Is that?
I think it's something that's happening in Hawaii. They have a hospital for heroes.
Right. So there's other.
I'm not a hospital. Hotels for heroes.
Yes. So there's other jurisdictions where the doctors and nurses are being accommodated in the hotels, and so. I asked, and we had a conference call with some of the, with Homeland Security, with Department of Labor and DRT, and some of the issues that we discussed about was the relief fund, different types of relief funding that we're getting from the federal government, and so we won't see that money for weeks. Some of DOL doesn't even see a baseline on coming from the federal government, any guidelines on how we're going to address this unemployment and so forth. So a lot of these things. But in Homeland Security, I asked Chuck if, a very pointed question, will the governor get reimbursed from FEMA for the hotel quarantines and all these, the items that we're doing to mitigate in response to the COVID? And Chuck said yes. So, these are the things that we can put forward, the people's money to accommodate these nurses and can be reimbursed by FEMA, because this is how the process takes place. And so really, I know it's a difficult time for our government, but we need to start investing back into the people at this time, the money that they paid in their taxes for us to respond more quickly to their needs.
Vice, have you been in contact with the administration? Because I got a message here on the WhatsApp that they already have a hotel or a condo for GMH and SNU nurses and doctors that stay after work. Are you looking at expanding this, or what's the deal?
Right. So apparently not everyone is getting it. If that's the case, I did not get any response of them saying that they had these accommodations in place. But perhaps maybe they already do, but not everyone is being offered the same lodging and the same equity in pay.
So that's what you're hearing, and from people who don't.
These are from our nurses.
Mm-hmm.
So maybe they need to offer it for everyone, if they've only offered it to some.
I want to ask you about the pay thing of Vice, because I think it was Superintendent John Fernandez at kind of the beginning of this. He had said, and God, I wish I could track this down, but something about people working in the government during a public health emergency or something, that they're supposed to get like double pay.
Right. So in the rules and regulations for Department of Administration, there is compensatory hours that you'll receive, or double time pay when you respond to a declared emergency such as this. And so this is something that I was advocating for to, many people are not receiving this double time of pay. And I asked if this is also a reimbursement, can they be reimbursed by FEMA for this double time of pay in response to the COVID-19? And the answer was yes, FEMA would reimburse for the double time in pay. And I did ask that perhaps maybe compensatory time, if we don't have the money, because maybe we're stretched right now and we don't see any revenue really coming in, and a lot of the taxes are being deferred. so for some employees, compensatory time really doesn't do them any justice because either they're part-time employees or they're, just it's just a struggle for them to be able to utilize those hours once the COVID response ends. And so really, if we can get reimbursed by FEMA for this, and we can pay our those that are responding, we can pay them double time, then let's give them the money that is due. They're working for us 24 hours a day. They're sacrificing the well-being of their families when they go back home. I think this is very small justice that we could give them, and really for the work that they're doing to keep us safe. You can't really put a price on that.
Mm-hmm.
Well, the governor put a price on it, and that she had said that they're getting 25%. Right?
Yeah, it's 25%, and then it depends on your level of exposure. But she only said that it was in effect immediately, so she wants it to be applied retroactively.
Right, and so Senator Shilton and I submitted a bill on hazardous pay, and so we are looking to amend that just so that the governor can do the hazardous pay. But this is different. This double time is a different, another entity where it's in the rules and regulations for a declared emergency. Hazardous pay is when you are face to face with the extreme danger, right? So our nurses, our doctors, our frontliners, our first responders, they should get hazardous pay. The firefighters, they don't get hazardous pay, so they should get hazardous pay. I know we can't afford to pay them hazardous pay for a whole year because they make so much money because of their schedule, which is fine. But they need to get. It would be just to give them hazardous pay during this time.
Vice, can I ask what session are you planning to introduce these bills in?
Hopefully, when the speaker calls session, hopefully soon. These are the bills that I'd like to see come to fruition. These are the bills to include the unemployment bill. I know that there's been some back and forth about whether the administration is asking us to hold off and wait on federal programs, but we've waited since March 15th, since I've asked to come into session to this day, and thousands of people are now unemployed. Thousands of people have furloughed hours, and really they don't know what to do. I mean, to see someone cry over how they're, to see someone hurting and just in a crisis about the impact of the financial strain, it really hurts because not many people are as fortunate as government employees to continue to have a paycheck as we're teleworking and all these things, and I feel that this is just not equitable, that us in the government are getting our full paychecks and we're getting paid, everyone's getting paid, we're teleworking, we're still performing our job, but we see in our private industry a lot of the people who is a majority of the population who pay their taxes are suffering from this now, and we're not responding quickly enough to get them some kind of compensation for the impact of this virus, even though, and we know the money's coming, so there's no reason why we should be reluctant to move forward and give them something so that they can be able to not even to live. We're not even asking this is just necessities that this is going to be provided for them. It's not an extreme luxury for them. They're not going to be going on Amazon and ordering things online and stuff like that. These people just need the necessities to be able to survive, which is just food, water, and the utilities that they need to pay just to survive, and gas. I mean, it's a small ask.
Right. Yeah, and I don't understand why there's only a handful of senators who are talking about this. And
yeah, what are we going to do? I mean, the governor on Sunday, she said she needed legal authority to implement a curfew law, travel restrictions, all of this. Nowhere in there did I hear when she spoke, we need to get assistance for these. Right now, it's 15,000 people that are unemployed.
When you ask about it,
hours are reduced.
They get mad. It's weird. It's like we're just asking for
all
these
it is
people.
Is go apply for food stamps, call public health, or go online.
Honestly, that's weak. It's weak. I mean, I'm so disappointed in the speaker. Vice Speaker. I just don't understand it. This whole,
We're moving bodies out of the morgue right now.
that's where we're at. And there's that going on. And then there's that people are being told, stay home for another month. We got no clue. David De La Sola talking about pandemic unemployment. He can't even provide a timeline.
Because the federal government
Right.
isn't communicating with him.
And so with this stimulus and, the $1,200 payments, I mean, at least 3 weeks, but probably longer.
Right, and so we should do this now. We should have done this back in March 15th so that we could avoid all the complications of now us having to come into a consensus on how we're going to have session. We should have done this. We should have done this in March 15th. We should have done this right when the declaration was declared so that our people know that they're taken care of. Our governor knows that some money needs to be set aside to assist these people. And now everything is just unraveling, and it's getting harder and harder and harder to meet the needs. And now we have to start all the way back from square one in the middle of the crisis,
right,
when we should be focusing on getting better, staying home, and all these mitigations. But now it's just even more difficult because everything is just imploded on us. And so we need to act. We needed to act since in March, and now I'm asking that we're trying to come to a consensus where everybody in the legislature feels comfortable coming in. It's difficult for some of them, and I understand it. They have underlying health issues. I have the same thing, but they take care of their elderly, and I don't want to, push them in a way where they're also endangering their parents or their grandparents. And so we just need to come to a consensus quickly that we're going to hold session in this manner and move forward. We've been talking about this for like a week and a half now.
Yeah.
And so I've been pushing, and some of my colleagues have been pushing for a compromise somewhere down the line. It's very difficult to get everyone to agree. And I've put it out there. I said, look, our government employees are out there on the front line, risking their life every day. They go home to their children. They go home to their parents that they care for. I said, we need to be leaders. We need to show them that we will not ask you to do anything that we won't do ourselves. And so we need to lead from the front. We need to start showing the people of Guam that we are here. We're going to lead from the front. And we're not just going to hide behind, our doors and in our comfort. People are suffering. We cannot be living in our comforts right now. And many of my colleagues, they're working really hard. They're working really hard for the people. Even though we can't come into session, I see all of them. They're concerned. We're talking. They're talking to people, trying to mitigate a lot of the issues that, the homeless. Senator Shelton, she's advocating for their foster children. She's advocating for the homeless, and she's seeing the impacts in other countries. And she's working really hard for that. Senator Talahi, she's been trying to get us to have some kind of virtual session. She's working on these evictions. And it's, people are working to try to find some middle ground. And it's just very difficult, and we've been talking today. We're going to talk again this morning. Hopefully we can come to a decision, and we can move forward and just make something happen, because I am not comfortable in this, hands are tied, and we need to pass legislation.
Yeah, but who's tying your hands? I mean, the speaker is tying your hands. I mean, pretty much she's tying your hands, and the governor's giving her the rope.
Well, with all due respect, our speaker, yes, we've battled it out for session 4th, but she's trying also now to come to a compromise, and it's difficult because there's also some pushback on whether we're going into virtual session and all these things. And so, the speaker has said that she wants to come into a physical session where everyone is present, and Senator Lee has presented many plans for us, and the Committee on Rules has presented many plans for us to mitigate the risk. It's just very difficult to get some of my colleagues who, of course, which is understandable, that are concerned about their health and their grandparents and their family. But
can some of them come in?
I mean,
through
you don't think
video
we're concerned? You don't think nurses and doctors out there are concerned about their health? I mean,
right, and you're right, and then that's why I came up on this morning just to advocate for our nurses, because there's no, from my understanding, it's not equitable for them, and so hopefully we can see the accommodations provided. Hopefully they can get word today that they will be paid, an equitable amount of pay. Even our nurses at GRMC, because we can say that GMH is a COVID hospital, but there's nothing, GRMC people are still going to be exposed. Our nurses and doctors at GRMC are still going to be exposed. And so whether they're working at GMH or not, it's arbitrary, because you're working in the hospital. This virus is going to spread. We saw in June that we're going to have thousands of deaths. And so it's not only going to be at GMH. It's going to spread in our community. The peak is in June. And so we need to also look at our nurses as a whole, not what agency you belong to, whose payroll you're under. This is not the time to cause that kind of division. We need to provide equitable payment for our nurses and allow them to be able to work in these kind of environments, focusing on the mission and not having to worry about trivial stuff when they get home.
Vice, what can you tell us about, so I know you guys are debating what type of session to have, but when you go into this emergency session, which we just got word that there might be an announcement about it today, in case you didn't know.
Wonderful.
When you go into this emergency session, are you guys going to be able to also hear your bills? Because I think the optics of it is that we're not doing nothing locally. I mean, you guys are trying. Senator Terlai's trying. Senator Sheldon's trying. Senator Moylan's trying. Senator Teller. People are trying to get COVID-19 related bills. Their time of day. But is that going to be something that happens, or is it just like we're going to an emergency session to give the governor more power?
I don't agree to going into an emergency session for one thing. The session is 15 people in a hall, and we are going to get the support of our colleagues to move other bills. And if our colleagues don't support the movement of these bills, then the people of Guam will see. And if that doesn't apply enough pressure to them that the people of Guam will see, then, our...
Well, I think the people of Guam right now are seeing a whole lot of nothing going on.
Right. And so, our 2-year evaluation report comes up, and if we do our job, we keep our job. If we didn't do our job, we don't keep our job. And so really, this is the beauty of democracy, right? People can say, well, we gave you a chance and you didn't act on it, so you got to move on to other things. You're fired. And so really, the people of Guam will see, where is the session heading? Is it only primarily to give the governor powers, or are we thinking about the people? Are we thinking about those suffering? Are we wanting to help those and meet them in their suffering? And if we have no action in that, then the people are free to fire us. And then that's up to them.
Well, there you go. Vice Speaker, can you keep us posted about what's happening with session and, what type of session you guys are going to have?
Yes, I will send you a note.
Thank you.
Thanks.
Thank you. And thank you to the nurses and all of our first responders, and to the people, really, to our police officers trying to keep order, maintain order. Thank you, everyone, for the hard work that you're doing to keep us safe, truly. May God bless you.
Take care.
Thank you, Chris and Sabrina. Take care.
Okay. Vice Speaker Talina Nelson there, 8:23. And that's, I think, the big conversation with the legislature is, whew, man, I don't envy the speaker, because, I mean, she's trying to keep a lid on this for the governor, and you got, every senator who has their idea. And like, Vice said, it's I look at it as like a marketplace of ideas. You got 15 people, 15 different ideas. I mean, the governor is not going to have all the good ideas. She's just not. There's no way. They need more ideas. They need more people. And so
there's been a lot of bills actually that have been introduced, just sitting there.
Just sitting there.
Just sitting there.
Just sitting there, collecting dust. Don't forget to disinfect your bills that are collecting dust. 8:24. We're going to take a break here, do some news. It's containing COVID. We'll read some of your Facebook comments coming up. Again, the number 637-0094. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please. Stay home. Saga Gigimatmizu.
Off day, Guam. My name is JJ Ambrose. That's Juliet. This is Isabella. And that's Applejack. For the last 2 weeks, pretty much since she was born, we've been stuck at home in quarantine. I miss my friends. I miss family. I miss going to the beach. And I definitely miss going to school athletics. But the silver lining is I get to spend more time with them. We've been catching up on homework, working out, and I've been changing a whole lot of diapers. But I know there's an end to this. We've been doing our part. We're asking you to do the same thing. Stay home.
We've heard the latest information. I mean, just yesterday we learned there were 17 more cases. We've seen the projections from our medical team that really again a lot of that sobering data that we all have to take seriously.
Guam Department of Education Superintendent John Fernandez said following Governor Lulian Guerrero's executive order to further extend the lockdown until May 5th, he made the call to end classes, cancel fourth quarter sports, and close down schools for the rest of the 2019-2020 school year.
We discussed this amongst my leadership team, and I mentioned to some of our board members, there doesn't seem to be any possibility or any scenario where bringing 30,000 students and 4,000 employees back in contact with each other at our school sites on a day-to-day basis. There's just no scenario where that makes sense.
Fernandez sent a letter to the Guam Education Board members this morning informing them on his decision and asking for their support on the matter by suspending certain board policies. The policies up for discussion at the special board meeting scheduled for Wednesday, April 8th at 3 p.m. include grading, promotion, and the service learning requirement for high school graduating seniors.
The third quarter grades seem to be where everybody seemed to reach a consensus on. These are grades that the students did earn through their work and effort, and carrying them over to the fourth quarter, even though we know that some students may have wanted to do better and work harder, or some might have not done as well. We're just going to have to call it even.
Fernandez adds it's highly unlikely there will be a physical graduation ceremony.
Half a day, Guam. Stay home and keep safe. And if you need to be out, Wendy's is ready to serve you with affordable meals and drinks. Drive-through only. The real deal for value and variety is at Wendy's.
828 containing COVID. I was so lucky to get Linda and Pinko DeNorsi from Public Health on the line. Good morning, Linda. Thanks for joining us.
Good morning, Chris.
We wanted to start out with the results last night. There were only 13 tests that were ran by Public Health, and previously there were 20, there were 40. And I'm just kind of, if you could explain why there was only 13.
Yeah, actually we tested a total of 16, but the ones that we had to rerun or their follow-ups, there were 3. So that was already counted in the individuals that were tested. And as you know, 1 tested positive, 12 tested negative, and then the remaining that we did was for the CNMI, because as you know, the USAPI, we being part of the selection of our island, Guam Public Health Laboratory, we're able to also provide testing for the CNMI and the Pacific Islands. So,
how many did you guys run for CNMI?
Yesterday we ran a total of 4. Okay. 4 or 5.
So you basically ran one 20 test load and...
Yeah, there were 3 follow-ups. That means we reran them, and they were run before, so that's why. Now, in regards to the reason why we only had that much is also because those that are asymptomatic, as you know, these are still being prioritized. So the ones that are more critical are run first. Right. And we also have the diagnostic laboratory that we are also sending asymptomatic specimens through them, which they're running it off island. And those are the ones that are the lower end of the priority listing.
Right, Linda. Thank you. Because people we were wondering about that, and so that was why there were 20 run, but So we're sending off DLS. We spoke with Dr. Akamoto yesterday. He said the commercial testing, it's up and running this week. So people, how about the central public health that you guys just opened recently? How's it going there with testing?
Yeah, it's going very well, actually, and we're also expecting more test kits. Actually, we just received yesterday another box, so that would be about 400 more test kits. And I just received word today that another 4 boxes of the RNA extraction. This is the kit that will help us to do the testing for the coronavirus, is already on its way from FEMA. And we're just expecting that. It's already flying through at this point in time to California. And once it reaches California, it should be heading towards Guam. So it should be soon. And then the U.S. Department of the Interior also funded all the U.S. APIs. That's the Pacific Islands grant. And what happens is Guam received a total of another 460 boxes of another type of testing, which is through the Gene Expert machine. It's another type of machine that the department also has. And so that equivalates to about 4,600 more test kits for another type of machine, which is the Gene Expert. And so that is already in motion. And hopefully we'll also have with that 4,600 nasopharyngeal swabs, test kits, swabs, and then 1 box of the quality control kit. And so that's what we're getting through the support from the Department of the Interior through the Pacific Island Health Officers Association.
Okay, so when we get all this equipment that you're talking about and supplies, are we going to see more tests being run?
Yeah, it's not an equipment. These are all just test kits because we already have the equipment at our laboratory. Right, yeah. Yes, we have 2 machines right now. We have the ABI 7500. That's the one that's running all the coronavirus test kits as we speak, with all the test kits coming from US CDC. And then the other one is a machine called the Gene Expert, and this machine is also now with more testing for coronavirus. And so once we get all this, then we'll be able to have more capability of running both the 2 machines that are located at our Guam Department of Public Health Laboratory.
Linda, we know that this has been something that you've been telling us for a few weeks, is that you've been out there trying to build our testing capacity, and it looks like we're doing that. What is then the? Are we going to see mass testing or
today
or any? When we get? I mean, because you said we're getting 4,000 some.
Yeah, 4,600 for the Gene Expert. Yeah, and today actually yesterday it was delivered another box, so we have about 400 more test kits. So we are still going to prioritize, Chris. The priority is always going to be those that are in the hospital, those that are hospitalized and they have the COVID symptoms. And then the second, of course, the other priority groups are those that have chronic conditions, comorbid conditions with COVID symptoms. And then, of course, the healthcare workers with COVID symptoms, because we need them to continue, and we want to make sure that they're protected and that they don't, if they are infected, we don't want them to further spread anything. And so that's why they're very critical. And so all these top priority groups are going to be the priority first, and then if you get anyone else, whether they're asymptomatic, right now the asymptomatic, we're utilizing DLS to send them off island, so that that will still be done. Right now I've already instructed DLS to go ahead and proceed with the Medicaid, MIP, and uninsured patients, and those with insurance, of course, we're going to try and bill them through their insurance provider. But in the meantime, that's what's happening also. So as you can see, we ran these tests. Today we're going to run another 20 in the morning, and we're anticipating that more will arrive. We have about 13 left that are still here. But again, when the day starts, we get more and more coming in from the other clinics and also the hospitals, both Guam Regional Medical City and GMH. And so again, when we get more, we prioritize whatever comes in, and then we run them. Okay?
Okay. I wanted to also just gosh, I lost my train of thought.
Let me ask you then, Linda, because I had a question. So for the record, we are still on the limited priority testing group.
We're still doing the priority testing group at this point. Yes.
Okay.
And then that is all because, again, the physicians group, the advisory group that makes that criterion, again, specific for Guam. Because now that we're receiving test kits locally, it's up to us to decide how we want to do our testing. And so that's why the physician groups, and these physician groups are representative from Guam Regional Medical City, a physician also from GMH, and also the other private clinics, and of course our public health director as well. And so they all come together, and then they develop all these criterion. So that's what we're following.
Right.
I wanted to ask, because this is an issue that's been brought up a few times on this show, and from the mayors, and then just recently from one of our callers, in terms of why can't we release the names of these villages? I mean, we're identifying the Iglesia Ni Cristo Church, Hafa de Bingo, but not breaking it down from village by village.
Right, because we're still doing the contact investigation, and again, we're trying to piecemeal all these different types of contacts that are occurring, whether they are household contacts or they're also contacts by the community. So we're trying to identify, are there household spread, which we already know that is happening, and also community spread within the community, meaning they don't have to necessarily live with each other, but they're exposed, whether it's because they're seeing people in congregate, meetings, like what we have experienced with the Hafa de Bingo, and also with the Iglesias Ni Cristo, different types of church settings, which are in different locations. And the answer really is we're still putting everything together. We're getting piece by piece, and we're just trying to put that together. Realizing we do report where they are located, but just in the northern and southern. And I really think that that's why we're not really, we're getting a lot of calls, and not only are we getting calls, we're getting also information from people that are testing positive, and then our surveillance team and our investigative unit first is the first to start the investigation for a positive patient. And then after they do their investigation, then we also have our other units, which is the surveillance team that do the surveillance and contact follow-up. And then after that, we then have the isolation and quarantine units within our department. So we're putting all this together. I realize that a lot of people are asking, which villages we have, the information. But again, we're just trying to track all of them and trying to get a cluster group of study that we can gather together. I think that's pretty much what we're trying to do. So I hope that answers your question.
So Linda, you're saying that we have the data, the village data, it's just not being released at this time. So you anticipate that data going public anytime in the near future?
That will be a decision that I would have to meet with my staff, and then we'll make that decision. But right now we're still doing the clusters and trying to do the study as far as where the index case is coming from and how the community and the household contacts are occurring.
So since you are able to release the Iglesia Ni Cristo, so there is for sure a cluster of cases there. And how many? What constitutes a cluster?
Well, clusters meaning you have one person that gets infected, and then, of course, there may be other people that are infected, and then for sure we'll know when their test comes out positive, then we can identify all those people in that setting or that congregate group, right? And so that's how what we call a cluster, meaning they're all gathered together, and then they're all linked to that specific location or that person that happens to be positive, and who else was infected by that individual.
So how many in this cluster at
Iglesias de Cristo?
Yeah.
Okay, we're going to have to, I can get that information, but I don't have it right now. But I can get it for you, and I can also provide that to you like I always do when I don't have the information.
What about the Hafa de Bingo? We hadn't heard anything else about that.
The Hafa de Bingo right now, okay, their 14 days has been over, so if they haven't gotten infected, then that's fine, because a 14-day time frame when they all gathered is up. So that's why they've been removed from our list of the ones that are very critical to monitor. And so that's the reason why we're not going to include them in our announcement, because we already announced that previously. And so their 14-day of quarantine, whether they're going to do the home quarantine, it's already up. So we're not too concerned unless they gathered elsewhere. and then they're linked to somebody else that could be infected. So again, it depends. If these people keep roaming everywhere and they're not following what we're recommending is home isolation and also home quarantine rather, and if they are infected and they're mildly infected or asymptomatic, home isolation, or if their home is not conducive for home isolation, then they go to our Guam isolation facility. So that's why we want to make certain that people are following the social distancing, people are following all this, so that this will help us to delay or prevent the further transmission of the coronavirus.
Linda, what about the children testing positive? I mean, that that was a big announcement at the press conference.
Yes, it was. We announced that yesterday. That is correct. We have one. Yeah, the age range, right?
Yeah.
The 0 to 9, that was a 1-year-old baby, and that was through a household contact. And then the 10 to 19-year-old bracket, there were 5, and of that 5, 3 were also household contacts, and one was travel related to Honolulu, and the other one was a social event.
Were any of these
what social event? Because I thought we weren't having any.
They contracted it from being in a social gathering.
Wow.
Are any of these connected to the quarantine facilities?
We have to, if they're going to be connected to the quarantine facility. First of all, if they're test positive, right? If they are in quarantine, then they'll be moved to isolation. We've had other cases. Remember, I went to court for March 19, Philippines, right? Okay, that event that happened, we did see about positively 3 that were tested positive from the quarantine site. So we had to move them out of the quarantine site into the isolation facility. And then there was one contact that communicated really very closely with somebody that was positive in the quarantine area. He was also under quarantine. So we delayed him from leaving. So we just extended his quarantine. Now, if he experienced any symptoms, then he would be also moved to the isolation facility.
Linda, I'm trying to get a pediatrician on the line, but I think what parents now are kind of wondering, since yesterday, is how do kids do against COVID-19?
Yeah, actually children do very much better than those with comorbid conditions. That's what we're seeing right now. I mean, every case is different, right? Depending upon if that child also has other conditions. So it's really, if they don't, then the likelihood that they're going to do fine will be there. But I'm not an expert in regards to physicians, so I would divert all those questions to a primary care provider. But just answering your question also about we have 92 cases with no travel history that I reported yesterday. And today I'll report more data that is updated as of yesterday's testing. But imagine 92 that had no travel history, and of that 92, we're finding 24 have household contacts, okay? 11 are community contacts, 13 are healthcare contacts, and of that 13, 5 as a patient, 8 as a healthcare worker, and 44 did not report any contacts at all. So we're gathering all that information and we're providing it to the public. So
that's the evidence of the widespread community spread, right?
Yes.
That could be like
correct.
Going to the grocery store.
Yeah, and so this again, going back to what the governor's, one thing she's been very consistent on is stay home, stay home, and this is why we have to stay home, because the virus is out there. It's not only out there; it's in our homes, and we're giving it to kids, and we're just giving it to everybody.
That's right. And when we do the investigation and we find a patient that's very much positive, whether it's a parent, we do have to examine the household, how they live, and if it's not conducive, like they have other family members, like an elderly that lives with them, or let's say another parent that has a comorbid condition, we don't want to leave that individual in there, because then they're susceptible and they're more at risk, because of their comorbid conditions, that we don't want them to be isolated in that particular home. So that's why we move them. Okay.
Okay. I just wanted, before we let you go, we wanted to ask one more time, because we did try to reach out to Tess Archangel, because
Yes.
she's the one who handles the
food stamp, the SNAP, yeah.
Right. And so for people that, we're looking at unemployment numbers right now currently at 16,000. Where do they go? What can they do to apply?
Yes, Tess will have all that information, but they can call. We'll have those numbers available to the public. They can call the Division of Public Welfare, and I think what we'll do is I'll give you all the numbers of the different locations, and then we can have that readily available, and we'll provide that also to the call center, and that way all the calls that are coming out can be filtered, whether they're going MIP, Medicaid, SNAP, TANF, aid to the totally disabled, and aid to the blind, and so forth. So we'll get that. I'll have Jess. I'll call her as soon as I'm done with you, and I'll have her segregate all that out. So
can you just
numbers?
Give her my number, and then we could, because what I want to do is I want to get her on, and let's say, so how much do I qualify? How much do I got to make? How much what are all the qualifications, so that people know whether or not they should bother applying.
Not a problem. I'll give her your number as soon as I get off the
phone.
Thank
you, Linda.
I'm on my way to another meeting.
Okay.
Thank you so much.
Thank you, Linda. Thank you.
Bye-bye.
Be safe.
God bless you. Wash your hands. All right. Linda and Pinko, Denorsi, of course, Public Health, Social Services. Man, I had a comment here. I didn't see it in time. What happens to those who recover? Should they retest them to make sure they test negative before sending them home? If that's what they're doing, because I read somewhere that they can still test positive after they recover. Well, yeah, if we all have it and you recover, I wonder, though, if that's something we haven't been able to get an answer to. If you have it and then you go out, can you catch it again?
You can ask that question in the press conference today.
Okay, good.
Or something else.
All right.
Knows.
8:46. So that's Linda. Did you have anything to go over?
No.
Okay.
Just no.
Stay home.
Mask up. Wash your hands.
We talked about this yesterday. While they figure out who's got the authority, just know that we have the power to lock ourselves down. So let's do our part. We don't need the governor and the senators to tell us what to do. We can just do it.
Exactly.
Okay, so we'll take a break here. It's 8:47. Containing COVID on KUAM-FM Agati, Guam. Good morning.
CBS Primetime Tonight.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
I'm Sabrina Sauce-Mazzanotti.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
We don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social distancing. You know the drill. Wash your hands.
And stay home! Just stay home!
Stay home!
They're a collective of undergraduate students from the University of Guam and Penn Foster College, aimed at helping the community during difficult times. Alana Fergerger, who handles social media engagement, explains the meaning behind the name Wonder Kid Project.
The Wonder Kid name itself is meant to represent hope and admiration. Going with the superhero-esque name, everyone who takes part in our mission, we hope, finds the superhero within them to give opportunity for the community to admire.
According to Point of Contact for Family Assistance, Maria Minas, with the COVID-19 pandemic taking a large toll on the island's healthcare system and affecting the lives of many, the team had a fundraising idea for a startup project to kickstart their mission.
This is a crowdfunding project for our local community on Guam who are heavily affected by the COVID-19 pandemic, such as our frontliners and families facing extreme poverty. Specifically, our main beneficiaries include the Guam Memorial Hospital Volunteers Association, Guam Harvest House, and St. Dominic's. And through your generosity, your donations can help purchase supplies such as masks, disinfectants, and food.
To date, the group has raised a little over $1,200. Project coordinator Aries J. Moreno.
I understand that it's a very difficult time for everyone, so If you would like to donate, you can go ahead and visit our GoFundMe page through our social media platforms, or you can actually go straight to GoFundMe and find the Wonder Kid Project Guam COVID-19 Relief and donate through there. And if you don't have the means to donate, that's okay. You can go ahead and just share our information through your friends and families.
If you would like to know more, you can follow them on Instagram at The Wonder Kid Project or email them at info.thewonderkidproject@gmail.com.
17 more positives were confirmed Sunday night, and 6 of those cases now include our youngest residents. Public Health Director Linda DeNorsi.
Of course, that was a 1-year-old individual. It's a baby, of course, and it was due to a household contact. In regards to the 10 to the 19-year-old age range, there were 5. And of the 5, 3 are household contacts. 1 was travel related from Honolulu, and the other one was a social event where they got the infection. It is troubling, and it's just a demonstration again that the COVID virus does not discriminate against age, sex, ethnicity. It is through all socioeconomic statuses. It's a virus, and it doesn't. It's not selective.
The governor adds that unless the public steps up and takes the isolation measures more seriously, the numbers will continue to climb.
I ask the people of Guam again to please abide and comply with these measures. It is very crucial that we do this as we are starting to see more increases in our cases. And the only way that we can decrease these cases, the only way that we can eradicate these cases is through social distancing, through staying home, through decreasing social contact, and so forth.
Meanwhile, the governor has asked senators for legislation authorizing a curfew for all and checkpoints to limit unnecessary travel. But at the media briefing, she said she's not heard back from them when session will be held.
Buenas and half a day. Mabuhay. What's up, Guam? I'm Norm. If you're watching this from home, then great. But if you're somewhere you don't have to absolutely be, please go home and stay there. I know it's difficult for us to change our routines and habits, and personally, I'd rather be with my family and friends dining in a restaurant or going to the movies. But the timing, it's just not right. We're asked to make a little sacrifice now, but in the long run, it'll help to ensure that you and your loved ones remain safe. We're dealing with an unprecedented health crisis, and we need everyone's cooperation. Let's fight the spread of the coronavirus by doing our part to stay home so that Guam can stay safe.
cool thing going on tomorrow at the University of Guam, COVID-19 telethon. All right, so we got the numbers, public health.
I'm trying to
She's
find
trying to get
it.
them, yeah. It's on their website, so you can go to their website. I believe I want to say dphss.guam.gov. All right, and I got Tess on the phone. We're going to arrange for her to do a call-in tomorrow morning. I'll give you guys a heads up on the time so we can all listen in and have her walk us through the process, start to finish, applying for the governor has told all of the thousands of displaced workers to go apply for food stamps.
Found it. Division of Public Welfare. It's 735-7274. That's 735-7274.
All right, and we're getting Ken Lujan from the SBA to kind of untangle the SBA loan process. There's a few different programs they have. Phil Flores from the Guam Banking Association also on tap. Wanted to jump in with Minority Leader Senator Tello Taitagui. Good morning, Senator.
Good morning, Chris, and good morning, Sabrina.
We have a few minutes. I don't really know where to start with you. Maybe we could just start at a session. What is the minority being told about plans for session and what type of session it's going to be and who's going to be able to do what?
Well, I did send a text to the speaker the other day, and still we have no call for session at this point. I did send out a press release yesterday trying to push for the Bill 322, which is very simple. It just provides the families who need the assistance now and for some kind of relief. And we haven't got anything yet at this point, I'm sorry to say. I mean, we're continuing to push, the majority leadership at the legislature to go into session. We need to start off first with a resolution that needs to be adopted to allow us to go into virtual session, and that still hasn't been, calendared in or scheduled.
Senator, can I just ask you, is what is going on here is you have the Democratic leadership, and these are, the governors, the go-to guys. Are we seeing them kind of, God, I don't want to say the word I was thinking of. Are we seeing them kind of block the progress of any session just to keep you guys from coming together and getting those COVID-19 bills introduced?
Yeah, absolutely, and I think it's even deeper than that. I think if we go into session, we're also going to reveal our financial situation where we are today, and also to see what the governor is actually spending out there. I know that in FY19 there was excess revenue, and still up to this day they're not telling us, how much is left over and has she spent any of that money. That was $23 million. And then you had the first quarter projections that came out just recently showing an excess of $30 million. So and then you have the war claims that are supposed to be coming shortly here. And if people are having to float their paychecks monthly, then I think the government of Guam can do the same and float, to allow those people who out there who need that assistance right now. There are people who don't have money to purchase food, of all things. Mm-hmm. She says that you can go down to public health and apply for SNAP. That's not easy. For a lot of these people, they don't have transportation to do that or the means to call up. And if they do, the phone is constantly busy. Now, there is money in there that we can utilize right now to give to those people who are most in need at this point. Going into session to allow the governor to do that is what we need to do. It's the first step. We have the option to do it safely, like all our doctors and nurses putting out, posts out there.
Yeah, you guys are late to the party, Senator. Everyone else on Guam has figured out how to work around COVID-19. I just don't understand what the holdup. I got to call out the rules chair again. I was just thinking last night, Senator Regine Bisco Lee is the chairwoman of Federal Affairs and Labor. I can't think of two more relevant areas that are front and center right now.
Right, neither can I. Have you ever heard from Senator Joe San Augustine?
We still have not heard from Senator Joe San Augustine. We asked the speaker to, let him know to call, but,
I've done the same for you too, Chris.
Yeah, I know. Thank you.
I heard that there was a letter sent to him from the governor's office that we have not been able to get our hands on. Right. And this is very disingenuous because if there's any information out there to, sorry about that, if there's any information out there let us know about our financial condition, then they should let us know, because then we have the means and the money that can be identified to help our people
Senator,
today and now.
Tell us, so are you basically saying that we have the money to float local assistance right now?
Well, if you do the math and look at what we've generated so far that was out there, the excess revenue in FY19, that was close to $23 million.
And
Then you look at the additional revenue projected, the money that came in the first quarter of this year for FY 2020. And it was announced already that there was excess, over $30 million in excess revenue. So where is all that money right now?
Right.
This is money that we can put out to the public right now, those who are in most need for assistance at this point. Now, if this, supposedly the congressman mentioned yesterday that in a couple weeks the war claims reimbursement should be coming into the government of Guam in a couple weeks. Well, then let's start floating whatever we have now, if that's true to form, coming in a couple weeks. And that's something that Congressman St. Nicholas needs to be doing and advocating for there in the federal government right now, pushing that money to Guam, doing what he can. And instead of, he's coming up with these solutions that right now I don't think anybody wants to touch the retirement fund. I mean,
that's kind of crazy. I mean, the Manumco, Senator Tello, the Manumco on this island are dealing with enough. They're the ones who are most vulnerable to COVID-19. And the last thing Tanana Tunpete needs is to wake up this morning and find out Congressman St. Nicholas and Speaker Tina Munia Barnes and Senator Mary Torres and Senator Jim Moylan are trying to play funny games with the retirement fund.
Mm-hmm. Yeah, that is something that I've had calls left and right, comments being made from bankers and investors and financial people who understand the climate out there. They're saying that's not a solution. Even though the congressman is trying to give us some solutions, what he really should be doing is pushing Congress back there, going to these federal agencies that are taking care of Department of Labor, U.S. Department of Labor, education out there.
You mean doing his job, because that's his job, actually.
Yes.
Yeah, his job is not to, powwow with a couple senators who really like him and, are going to tell, hey, what a great idea.
Yeah, why weren't all the other senators invited in on this?
Well, it was something that I asked a question to, and the next thing you know, on air, he answered, he only invited those who attended his conference. Well, he had a conference at 1 o'clock, the same time the governor had a very important message to put out on that day. So we did reach out to the congressman and ask, Jim Moylan, and reached out to him and asked him if he can change the time to at least 2 o'clock. But he said that was the only time available for the congressman.
Right.
And I couldn't believe that, because everybody's at home. What do you mean it's the only time? Or maybe we could do it the next day. But fortunately, he said he only invited them. Well, I went on that chat group, the Zoom chat. The governor hasn't started yet her press release. So I went on the other chat.
Wait, you were able to get on?
I was able to get on the Zoom, and I looked and noticed that only Senator Moylan was on it, and then everybody else that was on it were staff members from the senator's office. So these staff members were able to take notes and everything, so why didn't the congressman invite those people who were represented by that office?
I wanted to share something with you, Senator, that we had asked the Speaker's office yesterday about. I asked them to address specifically the point in the minority Republican Party of Guam letter that you guys had sent to the Speaker, basically saying, when the governor wants us to jump, we all got to jump, but we're not jumping to help the people locally. And the answer that we got from Shirag and the Speaker was, right now with the experts saying the worst is yet to come, it would be prudent to keep resources available to save lives. Furthermore, as per our congressman, he said that programs are currently being put in place right now as we speak, administration to administration, and passing any bill would risk the expedient implementation of those programs. To which I countered, I think this is the Bill 181 argument that we heard with the war claims, and that, Bill 181 is going to kill the federal this, and then it turned out to be not even close to being true. Obviously 1365 is now passed into law, and 181 was able to run its course. and no one ever was jeopardized because of it.
Well, we're standing strong. The Republican minority is standing strong to ask the Speaker to go into session. Zoom would be the safe alternative for anybody in the legislature who's uncomfortable going out there, who's following the rules of all our doctors and nurses to stay home. We have an alternative. And it's just not happening. But I'm not giving up. I will continue to reach out to the Speaker and some of my other colleagues to even start that petition for everyone to sign up. Let's start session. You get 9 senators to sign this petition, which is going to be going around today. Then we're going to present it to the Speaker and say, you have...
Is this where we're at? We got to get senators to sign a petition to give to the Speaker? What the hell is going on? Are you serious? Are you freaking serious?
It's a joke.
This is a joke. I mean, and what's crazy is all of you guys, who are trying to do good for the people of Guam, you guys are stuck on the Speaker's ride. You're stuck on this roller coaster, and your guys are going down. This is where I see this roller coaster is going down.
More like crashing.
Crashing down, yeah. And it's just really, I don't even know. I just don't understand.
Well, we got to continue to do our part. Everyone has to do our part, and as well as the Republican senators who are pushing it. We're going to continue no matter what it is, even if the idea doesn't sound right. We're going to try another idea to try and get her to call session. But I do appreciate, I can't be totally negative about that. There are some things that are going out there that are doing good for the people, and people donating food and helping your neighbor. This is good. We all need to do our part.
Well, I think that's right. Everybody needs to do their part.
Yeah, you guys got to do your part.
Unfortunately, the Speaker not calling session is not doing her part. And if
I just don't understand. Like with the Zoom, you guys had a mock trial, I thought, or practice.
We spent almost 3 hours, 2 different days combined to try and make amendments, how we're going to do the amendments, how we're going to call people to onto Zoom to testify. We had that all squared away. I thought we were almost done, and then Zoom, she calls off session the next day. So not quite sure how, why all of a sudden she did. I can only assume, and in these times, I'm trying to be positive, but it's very difficult right now.
Oh no, I try.
My job needs to do this, And by the way, I mentioned how people are donating and people are doing things. I greatly want to say that I appreciate the two of you nonstop. You've been there almost every day. Putting out this information and doing a great job at finding the answers for a lot of people. And I greatly appreciate that. Thank you guys, because I know you have families too. Yeah. And people forget that you guys too have families.
Thanks. Thanks for reminding me.
Yeah,
and
she's going to cry again.
I need to go because we're trying to push this out. We're trying to get them to call session.
Okay.
I'm going to reach out to the other side and see if they can help push.
Thanks. So please get them to do whatever you can.
And by the way, I mentioned earlier something that if you can ask, because you guys have great avenues to get questions answered. Why was the governor calling this a social isolation instead of a stay-at-home order like most states are doing right now? And in the stay-at-home order, most executive orders have curfews incorporated. They also have fines and penalties incorporated in these executive orders when it's a stay-at-home. So why is the governor asking the legislature to implement a policy for these 2 areas that are already being done in most states? U.S. states.
Yeah. I don't know. I asked her yesterday at the press conference, hey, have you heard anything about emergency session? And she was like, no. So I feel like if she was really waiting for it, she might have added something in there. But, I'm going to call the Speaker.
Well, the question to ask her is, why didn't you put a stay-at-home order and incorporate those things that you want the legislature to put in? And she says it's from the Attorney General's recommendation.
I wish we could get the Attorney General on the line.
Yeah.
I'm interested to see how he came to this determination.
Absolutely. I was wondering about that, if you ever had the Attorney General on your show yet. You've had everybody else.
Yeah, about price gouging.
Oh, okay, great. Maybe you can call him again, because then he can answer the question, then why are all the other states incorporating this in their executive order if he thinks that this is not right? And if I'm not mistaken, I heard the governor saying that there are certain things that she can't do. I believe she can do this.
I believe that if she did them,
power.
I mean, who's going to challenge her?
Exactly.
That's my thing. It's like, I mean, if you don't have the authority, you do
The
it.
AG's going to challenge her?
I mean, what? The AG ain't going to sue you? That's your boy.
Well, one thing I'm very appreciative of is that she's coming on every day,
Yeah,
you know, and,
sure.
and reaching out to the public and giving as much information. And I'm envious of the media, because they can ask questions. And I have all these questions in my head that I would like to ask too. But
Our questions are taken, Senator. You're not getting our questions. We got...
And we only get two, so...
Yeah.
Well, thank you so much again, Sabrina. Take care of you. Glad you're reminding everybody to wash your hands. And Chris, right on.
Thank you.
You're doing a great job, you guys. And
Thank you, Senator.
my best to you and your family, and the KUAM family, too, out there, who are also being a part of the frontliners.
We're not out there. We're in here. We're trying to do our best.
So you got to get from point A to point B.
Right.
And
Good
anything
point.
can happen.
Good point.
It's a chance you're taking when you do that. So, and I recognize it, and I'm sure everyone else recognizes it too as well. Thank you for
Thank you, Senator.
us informed.
Okay.
Thank you.
Bye-bye.
Right on.
Okay.
Well, it sounds like we're going to get a legislative resolution.
Right.
Hey, we're going to take a little break. It's
I don't think
9/11. Containing COVID, KUAM News, KUAM FM, Agotni, Guam.
All right, everyone. GU Self Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Day Guam. This is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay at home and stop the spread of the virus. Thank you.
Howdy, Marianas. This is Tomas Maglonia on the island of Saipan, reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
17 more positives were confirmed Sunday night, and 6 of those cases now include our youngest residents. Public Health Director Linda DeNorsi.
Of course, that was a 1-year-old individual. It's a baby, of course, and it was due to a household contact. In regards to the 10 to the 19-year-old age range, there were 5. And of the 5, 3 are household contacts. 1 was travel related from Honolulu, and the other one was a social event where they got the infection. It is troubling, and it's just a demonstration again that the COVID virus does not discriminate against age, sex, ethnicity. It is through all socioeconomic statuses. It's a virus, and it doesn't. It's not selective.
The governor adds that unless the public steps up and takes the isolation measures more seriously, the numbers will continue to climb.
I ask the people of Guam again to please abide and comply with these measures. It is very crucial that we do this as we are starting to see more increases in our cases. And the only way that we can decrease these cases, the only way that we can eradicate these cases is through social distancing, through staying home, through decreasing social contact and so forth.
Meanwhile, the governor has asked senators for legislation authorizing a curfew for all and checkpoints to limit unnecessary travel. But at the media briefing, she said she's not heard back from them when session will be held. For Guam's News Network, I'm Nestor Lecanto. Howdy everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to...
It's Tuesday, 7th day, April. Latest news. Kind of, let me just unpack everything. Cliff's Notes version of what you might have missed this morning.
That's a long Cliff Notes.
Okay, well, I'm just going to start with 13 tests were conducted on Guam. The results, one positive COVID-19 patient. If you're wondering why we only did 13 tests, we actually did 20, but 5 of those tests were for our brothers and sisters in the CNMI. Of course, other news that we heard this morning is that there are, well, we actually heard it yesterday, there are kids who have tested positive for COVID, and Linda Pinco Denorsi saying that there's been so many positive cases with no travel history. So that's evidence that the community spread is a reality. And that's why it's so important to stay home and to socially distance ourselves from each other. 9:16. Want to get Ken Lujan, as promised, from the Small Business Administration on the show. Good morning, Ken.
Good morning, Chris.
Jason's also here.
Hey, half a day, Ken. Thanks for joining us.
Good. How are you doing, Jason?
He's doing good. You want to put on your headphones, you can actually hear what he's saying.
No, I can hear.
Okay.
Yeah, so Ken, we just wanted to get up to speed because I know the last time when we spoke to you, our Nestor Lecanto interviewed you, and I guess I want to start out with the fact that you were highly encouraging Guam small business owners to get those applications as soon as possible because, like you were saying, the state of California itself, on the first day when this thing really started ramping up, I think you had 700,000 applications, which caused your servers to fall over. So has the SBA or has Uncle Sam kind of like tried to ramp up at least the technology infrastructure to be able to support the flood of applications as they come in?
Yes, they have. As a matter of fact, they changed the website initially because the initial website we had was an old website that we utilized for past disaster activities. And as a result of the influx of applications and concerns from the public, it overloaded our system. And so SBA quickly, within a week, shut down the system and revamped up to their capabilities to increase the capacity for the server.
Mm-hmm. And certainly we're not harping on any particular agency because I mean it's been a little bit chronicled now that because of the overwhelming demand for civic services and for public programs and people even making inquiries and everything like that, it's imposed such a huge strain on a lot of federal government and local government systems that like a lot of IT managers have basically said, we really got to figure out a way to handle this, has to handle the massive demand. So, like outstanding work by you and your colleagues to at least get that up. But as far as now that you can support the load, as it were, what is the application process like? And are you able to provide any sort of turnaround time for local small businesses on Guam that put in their applications?
Well, that's the challenges that we're having right now. This is an unprecedented event, so a lot of things. There's a lot of moving parts to this.
Sure.
We first ramped up by actually indicating that April 3rd was the first opening date for applications for the Paycheck Protection Program, and back in the mainland, just in one day, they issued out $3.7 billion, 12,000 loans. And we had about 875 banks that were participating in the program just in that one-day process.
Mm-hmm.
And so I can imagine, it's now Monday there, Tuesday here, that's probably tripled or quadrupled as a result.
Mm-hmm. I'd like to do our part as a media company to maybe kind of like help load balance, if you were, and like I'm putting on my tech nerd hat like now, but maybe if we can do so from a social standpoint to actually help redirect the best inquiries to the right channel. So what are some of the questions you're getting maybe that aren't necessarily under the SBA's purview and they could better be answered by other agencies, and like where should people go if they have those kind of questions?
Well, what we try to do, Jason, is we try to direct them to our main website, which would be at sb.gov.coronavirus. And within that website, they can actually get information relative to the EIDL, which is the Economic Injury Disaster Loan, as well as the PPP, which is the Paycheck Protection Program. And so they can avail themselves of this information and not overload the lines asking questions about it. So they can actually get that information beforehand, educate themselves as to which program will be best for them, that's best suited for them as a business.
Okay.
And then make that judgment in terms of where do I apply and how do I go about applying.
Are you also seeing, Ken, based on the number of inquiries, and I can only imagine like how many phone calls and how many emails and messages your office locally has been getting, but are you seeing a lot of businesses like maybe small family operations, and it runs a gamut from obviously sole proprietorships, small partnerships, family-owned companies, S corps. Are you seeing them not really knowing how to work with the SBA to this point? Because I would assume that for a lot of these types of operations, this is the first time they've ever actually interfaced with you.
Yes, you're correct, and that's something that we kind of were opposed to probably assisting in this case those who are not too familiar with the program. And so I've engaged our resource partners here locally in Guam as well as the CNMI, because both Guam and CNMI is an area that I cover. And so I realized that what the situation is, and so I reached out to my resource partners, which are the Guam Small Business Development Center, the CNMI Small Business Development Center, as well as the Chamber of Commerce and GCA, the Chinese Chamber of Commerce. Reached out to our resource partners and said, let's find a way to help our constituents out there and making sure that they get the accurate information at the same time too they get the assistance they need to help facilitate their loan application. Because some of them may not have a computer that they can actually use, or even be computer savvy for that matter. But what we try to do is we try to help them out through our resource partners.
Okay. Well, I'm going to steal a line from my broadcast brother here, Chris, because he's used the phrase, beacon of hope and beacon of light many, many times since we began this morning show format maybe about a month ago. But based on what I'm hearing from you and the delivery, it seems like SBA is really trying to say, like, that since we first talked to you again a couple weeks ago, that you really ramped up capacity, services, and the ability to accommodate a lot of these inbound inquiries and applications and everything like that. So is there anything you'd like to say directly to small businesses in Guam and the CNMI on that regard? Well,
the thing about it is that there's that area of uncertainty that all the businesses have, and I've kind of heard from most of all the businesses out here, indicating that when is this going to end? When can I open up shop? Can I actually rehire my employees? And there's a lot of concerns out there. But for every calamity, there's an opportunity, and that's something that I kind of encourage the lenders as well as our borrowers out there to look at these opportunities, look at the areas where you can kind of minimize any cost factors, areas that you could probably reorganize and restructure, because that the whole world has changed as a result of this. Both from how we provide services to the way delivery of services to the actual products and services that we have to offer nowadays. Everyone's more conscientious about health.
Yeah, Ken, what has the operational tempo been for you and your staff there, receiving, just this deluge of comments and people asking questions and everything like that? And how do you maintain, your own guidance level, and I guess your own sense of professionalism when you're hearing just these, stories over and over and over, and people are probably, giving you in exhaustive detail, what they're going through?
Well, I kind of sympathize for what they're actually going through, and the only thing I can offer is just offer assistance where I can give them at least a breath, some sort of assurance that we're here to support the small business community, We're here to provide the services they need, and we're here to guide them through the process as necessary. Other than that, they have to make the business, certain business decisions to either maintain their operations or to actually, close down, one or the other. But that's something that they need to make a decision on their own.
Well, I think that's very, very fair. And with this being the private sector, you've got decision makers who are now faced with like a very big decision, or probably several of them.
Yes, and that's the reality of it all. And that's something I wanted to make sure that small businesses understand what the reality is, and they really need to sit down, go through their financial situation. They need to sit down to figure out what they're intend on doing for the next coming months. And so, how do we staff this, and how do we prepare for the recovery efforts on their part?
Okay, and maybe my final question, Ken, because I know we want to let you and your staff get back to work. We appreciate the time that you can give us. We realize there is not a lot of it these days for you guys, and you guys are doing an amazing job. So thank you for your service to our community. But once again, and for the edification of people listening that may be small business owners, the entire process is electronic at this point. Is that correct? Do they have to do anything where they actually physically sign a piece of paper, or can everything be done like on a computer, like by way of a PDF?
Well, it depends on the program that they're actually going for, Jason.
Okay.
If it's an economic injury disaster loan program, everything's online. The loan application takes you, less than 10 minutes to do. There's no uploading of the documentation into such time as SBA requires it. But that program strictly is an SBA direct financing through that program. So we ask everybody to go to sba.gov/coronavirus and then you can probably just click on the application format and submit your application at that point in time.
Mm-hmm.
The PPP program actually is facilitated to our lending institutions here in Guam. We have 7 lenders. We've got the ANZ, Bank of Guam, Bank of Hawaii, First Line Bank, Bank Pacific, and the 2 credit unions, which are Coast 360 and Community First. So they're here to facilitate the PPP program. They're taking applications in now as we speak, and so that's one avenue which they can get financing from that direction as well.
Okay, and then I'm sorry, I know I said that was the last one, but I just thought about this before I let you go. As far as the status of the applications once they are submitted, for small business owners, is there like a URL that they can go to, or is it they basically submit the application and then they'll basically just have to wait until they are contacted by the SBA?
As it relates to the EIDL program, once they submit the application, they are given an application number, and at that point in time, SBA, about a week or so, SBA would probably get a hold of them and ask for additional information. Whereas with the PPP, that guidance is actually given with the lender that they deal with. The lenders will be in contact with them once they submit it in there.
Okay, Ken. Well, we certainly do appreciate the time once again, my friend. And I know you were saying earlier, the major roadblock was just the overwhelming surge of applications really caused your systems, like I said, to fall over. So the fact that has been rectified is a major step in helping these small businesses hopefully get on the road to recovery or provide them some sort of information they need. So we thank you very much.
Right, and if I could just say one last thing, Jason.
Certainly.
If everyone could just migrate into our website, sba.gov/coronavirus. They can also find additional information on the U.S. Treasury homepage. Very good information on the PPP program because SBA coordinates with the U.S. Treasury to actually provide guidance and rules and guidelines for our lending community as to how they're going to facilitate the PPP program. So those 2 websites are very key for obtaining information that would help.
All right, man. Can do, will do, because we're a step ahead of you already. Because when Nestor did that last story on you guys last week, we put links to both of those websites on our site and on our app. So thank you very much.
Thank you for your support as well.
All right. Thank you for your work too.
Yeah. Thank you, Ken. I just want to throw in my thank you too.
All right. Thanks, Chris.
Okay, Ken. Appreciate it.
Can never say that enough.
Right.
These guys are working hard.
Ken Lujan from the SBA, of course, with some a great info. We're going to get Phil Flores from the Guam Banking Association also on the show to talk about their involvement with the Paycheck Protection Program. And of course, I got to ask, and this is something we're going to talk about a little bit here, Congressman Mike Nicholas is, just to be clear, in a Facebook post, he touted these as solutions that would be available to the people of Guam within a week's time. But these two solutions, he called them. One of them involved the retirement fund. One of them involved the war claims, the reimbursement that's coming down from D.C. And so we're trying to get all of the stakeholders in both those groups, obviously the banks and the retirement fund. There was a message going around last night that, we said this earlier, I feel like Tanana and Tunpete, they got a lot on their mind. Last thing they need to worry about is someone trying to raid the retirement fund. So I put a call in to some folks over the retirement fund, and we'll try and get them on before the end of the show here. We'll take a break. It's containing COVID. KUAM FM, Agotni, Guam. Good morning.
GU Self Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Today, I'm Jonagan Charfris, senior producer for KUAM News, and I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home, to protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home, make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Thank you
Off
so
the day,
much
everybody.
for watching our KUAM News live Facebook feed. Yeah, so there was something that went down yesterday with Congressman Mike Nicholas, and he presented two plans. Now, to be fair, I do want to give him credit for presenting anything. The ideas about how to get local money into local people's hands.
Within a week's time.
Within a week's time. That's what he was touted. Did he over-promise? Is he going to be able to deliver on that? We'll see. But, Bree, you have details on there was a public plan and a private plan.
Right. So we're going to go over the private plan first. And this is a letter that Speaker Tina Munoz-Barnes wrote to Edward Untalon following that Zoom briefing that the congressman had with the Speaker and Senators James Moylan and Senator Mary Torres, and with other media except KUAM. But regardless.
We're going to get into that. No, I'm not going to let that slide.
Right.
We'll get into
So in the letter, the first proposal, under the congressman's proposal, the Guam legislature would essentially create a program allowing the government of Guam to pledge anticipated war claims funds, about $10 to $11 million, to be paid as interest to local banks that provide a bridge loan to local families for their anticipated economic impact payments as outlined in the CARES Act. At an interest rate of 5 to 7%, we anticipate this would allow for short-term advances of upwards of $150 million to our residents. Conceptually, for residents to apply for this program, the government of Guam would be a guarantor of these loans, allowing us to ensure the applicant's eligibility. The Department of Revenue and Taxation would then remit payments that are received from the federal government directly to the lending institution. So that is the private plan. It's one of two. We'll get into the other one a little bit later. But again, we do have Phil Flores. He is actually the vice president, I believe, of the Guam Bankers Association. Phil?
No, I'm not. No.
No?
Ed Antalon is the president. I'm just one of the
Members? Okay, all right. So what is your initial reaction to this proposal by the congressman?
I kind of go along with what Chris said at opening up the segment, is that you got to, it's good that the delegate is at least trying to do this, and you can tell him that he's pushing it hard. But in his haste, he didn't consult the bankers. I don't think he consulted the governor's office or GITA, and probably, I don't know, but he did consult the speaker before they had their conference yesterday. If he had talked to the banks, we could have given him some advice, because we appreciate what he's doing, but it's logistically impossible. I read in the Post yesterday there was like 114,000 applications. So let's say a bank got 10,000 of those, and the delegate wants us to be able to fund loans within a week. Well, 10,000, the math is easy. 30 times 60 times 60 times 24, it's just about 10,000 seconds in a week, 24/7. And the banks don't have that ability to get loans out that fast. And we can't take people into our offices. We're trying to encourage our customers to go online, use an ATM machine, to use your debit credit cards. And so, okay, we can do it online. I don't know what anybody means when they say we can accept these applications, process them, underwrite them, properly decline. I say properly according to consumer laws, decline those that we can't make, and then those that we accept, we would have to process, prepare the documentation, and close. And if we didn't want people in the office, and how many of those applicants who are getting a $1,200 check have e-signature capability at their home?
Wait, I think you hung up on him.
I did, yeah. So I'm going to try and get him back.
Okay.
Sorry, I'm a little rusty. But you know who I do have on the line, and we're just going to jump over to the retirement
fund.
We'll
get back to you, Phil.
Yeah, the chairman of the board for the Guam Retirement Fund, Mr. Wilfred Leon Guerrero. Thank you, sir, so much I know you were out there trying to cut the yard, right?
So this is actually there was another plan that was proposed by Congressman Michael Nicholas in that the Zoom conference that he had yesterday, and it would suggest to have the Guam Economic Development Authority draft an indenture with the Government of Guam Retirement Fund to provide the necessary capital for the local government to roll out a relief program. Now, under the congressman's proposal, the government of Guam would pledge the $10 million in reimbursements due from the War Claims Program as capitalized interest on the indenture. The congressman discussed a required 7% annualized rate of return or interest that would provide capitalization of about $142.8 million, which he estimates could fund as many as 116,000 applicants. And so, to carry out the program, GITA would be authorized to give out economic impact loans via an online application portal that would include the applicant uploading a picture or file copy of their 2018 or 2019 tax return. GITA would validate the applications and then deposit the funds to the individual. Once the federal funding arrives, the congressman proposed that such funds get put back to GITA, which the agency would then use to pay down the indenture that would have with the Gov Guam Retirement Fund. So, Wilfred, thanks for calling in and joining us. What is your reaction to this whole public proposal?
Well, as you know, this thing just came up, and so we're consulting our financial advisor, our lawyer, and what have you. But my gut reaction right now is that, look, the Government of Guam Retirement Fund has an unfunded liability of $1 billion right now, and this was caused by legislation in the past. And my feeling is that, look, please stop this thing. I don't know why they have to look at the Government of Guam Retirement Fund when it appears that there's another way of doing this thing, and that involves dealing directly with the banks, people getting loans and what have you.
So you had no idea this was coming? Not from Senators Moylan, Senators Torres, or the congressman?
No, I just heard it yesterday, and I said, wow, this. We're trying to protect the retirement fund because people, something go wrong with this thing, and then you've got a bunch of retirees and future retirees that are going to be adversely affected by this.
Yeah, and that's what we're seeing. There was a message going around on WhatsApp last night. I don't know if you got that message, Mr. Leon Guerrero. It was something about Congressman San Nicolas and jeopardizing retirees' paychecks. I don't know how accurate that message is, but what I do know is that when Tanana and Tunpete heard about this harebrained idea from the congressman, and now the speaker is going around, trying to knock on doors and get people to do this. So it's the speaker, it's Senator Jim Moylan, Senator Mary Torres, and of course the congressman. I think this is exactly what it looks like. It looks like a raid on the retirement fund.
That's what we're concerned about, is that if the other method that's being talked about, where people will go directly to the financial institution and borrow money, let the Governor Guam guarantee that. You don't have to involve the retirement fund.
Mm-hmm. Mr. LG, what would you say to the Guam retirees out there who are, especially the Manumco, because, right now the Manumco are the most vulnerable from COVID-19.
That's right. That's another thing, is that, to a lot of the Guam retirees, this is it. This is their income, and we're going to be jeopardizing, that fund by getting into something that I don't think the fund should be involved in.
What would your message be to the congressman? Because, Mosqueda and Call, they didn't even call you guys. So what's your message to Congressman San Nicolas, Speaker Tina Munia Barnes, Senator Mary Torres, and Senator Jim Moylan regarding this plan to do whatever they're trying to do with the retirement fund?
Please, we have over $1 billion unfunded liability by legislation that was passed in several years in the past. Let's not get into that anymore.
So what are you going to do today? You're going to be definitely not knocking on doors, but
yeah. Are you guys planning on meeting about this, Mr. Chair?
Well, we're gonna. The director has our professionals to give us input on this thing. But like I said, my gut reaction is this thing is like, for God's sake, it seems like there's a way of helping the people that are unemployed, and that would be like them going directly to the financial institution and getting a loan. Why involve the retirement fund?
Well, that's a good question.
Valid question. We would have asked that question if the congressman had allowed us to be in his Zoom
conference
media,
but apparently it was only for people who don't ask real questions.
Yeah, somebody called me up toward the latter part of that interview, and because they were telling me that, hey, they're talking about the retirement fund.
Mm-hmm.
And nobody consulted us about this. And my message is that please don't mess around with the retirement fund. We already got a $1 billion unfunded liability from past legislation.
All right. Well,
kind of seems like that's something that these elected leaders of ours should know. I don't know. Do they watch the news?
Well, I think they're just trying to solve a problem, and sometimes when you do that, you don't think about the
create another problem.
Consequences.
Well, Mr. Chair, are you doing okay though?
Yeah.
Okay, so.
Well, thank you for the opportunity.
Blood pressure probably went up after you saw this.
Yeah, you're okay. So we don't want the congressman and the speaker to be stressing you out.
Well, it's really you don't mess around with people's retirement fund. That's my whole point.
Yeah, we told. I agree with you, Mr. Chair. So I got your number. You can shoot me a message. Keep us posted on how this develops. But as your message was very strong.
Apparently they did get in touch with the director, and the director is trying to gather information from our professionals, and we at some point we need to talk about it. But like I said, my gut reaction right now is that look, we're in the retirement fund has a $1 billion unfunded liability from past legislation. They're going to add on to that.
All right.
Okay, Mr. Chair, thank you so much. Are you bush cutting or lawn mowing?
No, you know, when you're
riding more,
not doing anything, you do stuff around the house.
Right. Yeah. So you're on your honey-do list.
Yeah. Basically.
All right.
Well, Mr. Chair, thank you so much.
Okay, Chris.
Okay.
Take care.
See you.
Yeah, thank you.
Okay.
All right. That's Mr. Wilfred Leon Guerrero. Straight out of his mouth, you know what I mean? And I don't know how, the congressman is he gonna now go and beat up the chairman of the retirement fund for calling it like it is? And
disagreeing with him.
And so we're gonna get Phil Flores from the bankers to kind of close the show. And so the gist there of what Mr. LG was saying was, hey, go ask the banks, but the banks are saying this is an insane plan. And so I don't know if any more energy should be wasted on trying to compel the bankers and the retirement fund to do the congressman's bidding, which is what the speaker is like running with this. Yeah. I think there's quicker ways. I mean, but all the parties involved that we need to go ask are just saying, "Oh hell no."
Yeah,
and
I'm just surprised. Like, okay, we didn't think about let's just check them first and just see what they've got, and then
right. And the congressman's response, because I know that there was in the chat where the speaker's office had said, never have they seen such a massive proposal in which none of the parties involved were consulted.
Yeah.
So there you go. We'll take a little break here. It's 9:46, containing COVID on KUAM. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
I'm Sabrina Salsmatinati.
And I'm Chris Barnett, joining back to Phil Flores with the Guam bankers. And sorry, Phil, there's it's called operator error.
It's called rusty.
Yeah, I'm a little rusty with the buttons back here. It's been a minute, but I'm trying my best.
It's called a malfunction.
Yeah, there it is. It's a malfunction.
Yeah, there you go. So you basically, we got cut off, but you were saying that you were obviously in receipt of Congressman St. Nicholas's plan, which is to somehow get the banks to issue loans and leverage it against the
war claims
reimbursement that we're getting from the Treasury. So where we had left off was you were saying that it was well-intentioned and you appreciated the idea, and I feel like you were right at the but part. So, but
the yeah.
But hell no.
it is well intentioned, and good for him thinking out of the box. But again, in his haste, he didn't contact the governor's office or GITA or the banks. I have a feeling that the speaker and the senators, maybe the first time they heard about it was when they had their conference yesterday. And you mentioned just now, Chris, about now that we've seen the plan. We haven't seen any plan. We only know kind of like what we're asked about in the media or what's in the media, because the delegate still hasn't talked to us. But logistically, it's impossible. And I hate for anybody to get some false hope that we're going to, because the Post had something yesterday like 116,000 applications. I don't know where they got that number, whether it came from the congressman's office or not, but let's just say Bank Pacific gets 10,000 applications, and the idea is that we get them all out, all funded within a week. Well, there's only 10,000 minutes roughly in a week. That means we're doing an application 24/7 every minute, and we just don't have that capability. And I don't know, unless I'm Bank of America or Wells Fargo, who has that capability, because it's a special type of software. And when we were asked about it, we don't want 10,000 people in our office trying to get people to use online banking, debit card, credit card, ATM, whatever. And they said, okay, well, you can do it online. Well, what does that mean? We're not going on internet. You have special type of software that's going to accept your application. It's going to process your application. If you decline, it's going to give a proper consumer declination letter. And if it's accepted, then it comes through and documentation is prepared. We issue the check, and you've got to sign whoever it is has to sign the document. And my guess is most of the people who would be the applicants and the recipients of a loan don't have e-signature, meaning they have to come in here. Yeah. And that's not practical even for them, one per minute throughout the week. And so, to draw up a portal like that, you're talking about a couple $100,000, and it can't be done overnight. You just don't go to Quicken and say, hey, give me that software.
Bill, I got to ask you, because he didn't say it could be done overnight. He said that it could be done in a week's time.
You cannot. That's what I'm telling you. 10,000 applications in a week is processing one per minute, 24/7 for a week. We can't. Again, there's only 10,000 minutes roughly in a week. So how are you going to do 10,000 applications in a week? It can't be done.
Right.
I'm just reading this letter. It says from the speaker to Ed Untalan, because this proposal will likely forgo a public hearing in light of Guam's emergency situation, we therefore request your immediate response on the position of the Guam Bankers Association.
So we're going to have the Bankers Association really working closely during this whole thing, and we're having a 10:30 meeting this morning, teleconference or GoToMeeting, whatever it is, Zoom. At 10:30 this morning, and this will certainly be a topic of discussion because we have a chat room and we're all going back and forth and saying, what is this?
Right. So, Phil, because I want to ask you, and I already am anticipating when we do this story today, which we are going to do, and we are going to ask the congressman for a response, but good luck with that. Anyway, I just want to say he's going to say that he's the vice on the banking financial services. I know during that presentation yesterday, he said, hey, with my banking background, and so it's going to come down to him kind of defending his plan and saying that maybe he might say he knows better than the bankers.
Oh, well, God bless Mike, but he doesn't. And he's a congressman now, and he's trying to do a really good job for us in Washington, D.C., but no, he doesn't. No, he doesn't know banking like the rest of us know banking, because we do it 24/7. And we're all very, very busy with PPP, the Payroll Protection Plan, and people coming in for deferments. We're all very, very busy, and to think we can just put everything aside to try to do something that's logistically impossible, we're not going to. We're here to serve our customers. We're here to serve our community, and Mike is too. The delegate is too. And kudos to him for trying hard and thinking out of the box, but in his haste, he failed to reach out to those who would make it happen if it could happen. And I just don't think this one could happen. And I'm an internal optimist. When someone says to me about any of our businesses, we can't do it, and I say, just figure out how we can. We can do it somehow. This one, I can't figure out how to do it. I found out about it yesterday when the speaker called me, and I was thinking about it all afternoon, and last night I said, I wish there was a way to do it, but we can't do it.
Mm-hmm. What was her response when you told her that?
I think, when I said that thing about it, we can't take 10,000 people into her office, and she goes, well, you can do it online. And that's what I said. What do you mean we can do it online? You have to have a specific software program, again, which I can't go to Quicken and say, send me that software. And if we have to have somebody write it, you don't get software written quickly, especially right now with all the turmoil going on. It's going to take months to write software like that.
So how responsible, because we talk about false hope, and that's what I really wanted, because I kind of see this as it was, and bless his heart, he's trying to come up with ideas. Lord knows we need more ideas. But I really think that this was just kind of let me get some exposure and let me say I got an idea that I'm going to throw out there, but everyone we're talking to that's involved with these ideas say there's no way it's going to work. So how responsible was it for him to put out that, and this was something that was blasted all over Facebook, that he's offering solutions right now to get money into our local people's hands in as little as a week. So when you talk about false hope, I don't know if you can get any more false hope than that.
Well, I can't speak to his motives and whether he be providing that hope that I think is false on purpose. I don't think he did. Maybe he thinks it really could happen, but it can't. And again, in his haste, he didn't consult those who were coming to the party. And nobody can come to the party. And I like the fact that he's at least trying to help. But Mike, he likes to get out there, and he doesn't mind being confrontational. He doesn't mind taking on the establishment, as he says. And I don't think in doing this he's trying to take on the establishment. But I think he's doing something that just isn't well thought of.
So what should he do? Are there things that you feel that we maybe shortcomings, maybe things we could do with the federal government?
Well, the federal government is already helping us, and there's money that's going to come in, and if it's going to be here in 2 weeks or 3 weeks, it's still coming. And it's kind of like the war claims. We tried to get the war claims out here, and the delegate was saying, don't, let me do it in Washington. Well, now this is just the opposite. Get the chicks out there, and then Washington will send you the money later. I can understand his urgency, but I don't agree with his method. It's untenable. Period.
All right. Okay.
Well, thank you.
And I wonder if you're going to because speaker's already at the point where she's like, we're not even going to have a public hearing for this. So
I don't know. Is that legal?
We're in an emergency.
Okay. There you go.
I mean, I don't know, but I'm just saying it seems like from what you said, they're trying to move full steam ahead with this, but I think the retirement fund and the bankers are going to throw them off the track. So
yeah, because I haven't heard what the retirement fund is saying yet, but I can just imagine.
That's crazy. We got off the phone with Wilfred Leon Guerrero, and he was basically like, leave the retirement fund alone.
Yeah, I can see it.
Okay. Yep.
Hey, before I go, can I say one thing?
Yes.
We're all, like I said, the bankers, we're all trying to get people out of our office. As I say, you can come to the bank without going to the bank. So if you're out there and you're a bank customer for any of our 5 banks on island, use the online platform, use the ATMs if you need cash, and to stay away from cash, which can carry germs, use your debit card or your credit card when you go to Payless. And we're happy to see your smiling face as long as it has a mask over it. but really, it's better if you bank at home. So it's a good way to put it.
Right. There you go.
Right,
well, thank you.
I'm completely confident we're going to get over this. I'm not worried.
All right.
No, there you go.
Be
Okay,
safe.
see you guys.
I guess that's the inner optimist, huh?
Yes. Thanks for the opportunity.
Right. Thank you,
take
Phil.
care.
Okay, deal.
Okay, there you go. Phil Flores from the Guam
Bank
Bankers
Pacific.
Association and Bank
Bank
Pacific,
Pacific,
of course. Right. Yeah. So that's interesting. I guess there's a chat with all the banking guys, and they're kind of just like, what the hell?
That's cute.
Yeah. No, but really, I mean, we need solutions. And, I mean, when it's clear that a solution isn't going to work, I think you got to ditch it and try and work with something else.
But like you said, kudos to the congressman for trying to offer up something to provide immediate assistance to our local residents, and the number, is just keep climbing and climbing.
Right. Yeah. So I
and
think
we're
is
going on another month of this. So.
Right. So like they all said, well intentioned, but I mean, if we're gonna try and put money in people's hands and step on the backs of our retirees to get to it, I'm not down.
Yeah.
9:59. Bree, good job today.
Good job to you too, and good job, Jason.
And good job to our listening audience. Remember,
popsicle on a stick.
Yeah.
Man meat.
If you don't know what they're talking about, go back through the comments. I think it's safe to say I got a fan. Yeah. Good morning, Rosalind. So thank you guys so much. Remember, we have the power. We have the power to kill COVID, and we can do that by staying home, by socially distancing from each other, and by not going anywhere you don't need to go to. Okay?
That's right. That's all you got to do to save the world, save our island. Is just protect yourself, protect your family, wash your hands, stay home, and mask up. Thanks, everybody.
All right. My name is Chris.
Tomorrow.
God bless you, Guam. Adios.
Bye.